papers rustling, so I don't know if you
They're
can mute
not my
yourself.
papers.
No? Okay.
No, somebody else.
Okay, thank you.
You're welcome.
Could have been mine. So you're going to give us a heads up, Ms. Simoneau, when we're ready to go?
Yeah, it's almost there. Hold on.
Looks like Representative Perry is not muted.
I'll fix that. No, I can't
No,
fix
you
that.
can't. Yeah, hold on.
It's
You
okay.
guys do everything totally different than my committee.
Well, we gave up on Representative Perry readily finding the an unmute button. So
Ah,
we need
there
one
we
of
go.
those
All right, you're a
one of those
co-host now, Senator.
big, easy buttons.
Well, actually, that's when I'm on my iPad.
Well, that makes it harder. It does.
That's when I'm trying to do two committees at the same time.
Okay. So thank you for that, Aaron, and thank you for that, Darlene. So we're good to go now.
We're good to go.
Okay, so again, if you want to watch as well as listen, you can go to legislature.maine.gov, look up under the drop down for committees for Health and Human Services. And in the upper right-hand corner of our webpage, you'll see a link to YouTube. We have our very own YouTube channel where today's process will be recorded, and where prior sessions have been recorded already. We have a certain number of technical glitches to encounter every day. We anticipate those, and we've not been disappointed yet, so bear with us as we try and work that out. I've made sure my phone is off. Since this is a work session, we'll be focusing on the work of the committee to address the bills on our list, and maybe bringing in folks who are considered attendees at this point, if we have any questions that they might help us answer. Let's introduce the committee members, starting with Representative Lemelin.
Morning, everyone. I'm Michael Lemelin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Nobleboro.
Representative Zager.
Hello, everyone. My name is Sam Zager, honored to represent District 41 in Portland.
And Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Connor.
Thank you, Mr. Chair. Good morning, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Stover.
Oh.
You're unmuted.
Thank you. Good morning. My name is Holly Stover. I represent House District 89, including Booth Bay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Cadescag.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative and Chair Meyer.
Thank you, Mr. Chair. Welcome to all who've joined us here today. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I'm honored to represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. I will note, as I did yesterday, that several committee members are not present at this time of year with multiple competing demands. It's hard to have everybody in the same place at the same time, but they are part of our conversations. We also are assisted by a very able staff, and I'll start with Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Office of Policy and Legal Analysis. We do not take positions on or advocate for any legislation.
And Ms. Simoneau.
Darlene Simoneau, been doing this for 27 years. Whole new crew this year. It's very interesting.
Darlene is pinch hitting for Health and Human Services for our regular clerk, and we're grateful that you could be here and escape from, what is it, transportation?
Yes, it is.
Okay. Very good. All right. So with that in mind, I want to make sure there's no other pressing issues to be addressed before we start consideration of 582. Not seeing any, I'll turn it over to Aaron.
All right, LD 582 is an act to support the fidelity and sustainability of assertive community treatment, or ACT. ACT is the acronym. The bill is emergency legislation, meaning it would take effect as soon as it's enacted, and it accomplishes several things. In section 1 through 3, it amends the definition of assertive community treatment to align that definition with an evidence-based treatment model. It also adds definitions of psychiatric provider and medical assistant, and adds those providers to the description of the multidisciplinary teams that provide ACT. It requires the department to increase the main care reimbursement rates for ACT under section 17 of the rules by 25% immediately. It also requires the department to amend its rules governing the ACT program within 6 months of when the when the bill takes effect, and that those rule changes are directed to accomplish a number of things, including providing for a per member per month payment model, ensuring that there are no limits placed on the duration of ACT services, and that ACT services remain the point of contact for all clients eligible for those services, provide for initial authorization period of 1 year and no more than annually after that, allow billing for services for coordinating care during an initial engagement period of 90 days, and when the recipient is temporarily admitted to a hospital or incarcerated in jail or prison. Clarify the minimum contact requirements for a person receiving ACT services is 3 times a week on average over the year, and that those contacts may be face-to-face through a closed door or an outreach attempt in the home of the community. And finally, ensuring that the medical eligibility to receive services reflects an evidence-based understanding of the diagnoses and circumstances in which ACT is effective. The rules directed to be adopted by this bill are routine technical. You did receive some information that I kind of sprinkled throughout the rule provisions that provided some feedback or asked for some clarification relating to what those provisions might be intended to mean. I'm happy to go through those if you'd like me to at some point. You asked how many mental health agencies have closed over the last 10 years. I think that Mallory Shaughnessy was trying to obtain some anecdotal information from community providers. I don't know if there is a way to be precise about that number. I'm not sure if she has that information or was able to obtain it from her folks. The fiscal impact preliminary statement assumes an April 1st, 21 start date because it's emergency legislation. Obviously that date, if you were to pass this bill out of committee, would need to be updated since we're already beyond April. But it shows about 144,000 in general fund beginning this fiscal year, and about 625,000 in general fund beginning fiscal year 21-22.
So do you want to go through the sprinkled in comments, Aaron?
Sure. So one of the rule directives is requiring the department within 6 months of the effective date to provide for a per member per month payment model. You received information from the department that rulemaking within 6 months is not enough time to undertake a rate study that would allow them to develop a per member per month rate. There, with regard to the directive to ensure that there are no limits placed on the duration of ACT services, you received some information from the Alliance for Addiction and Mental Health Services that there is an informal 5-year maximum service length, but you received information from the department that there are currently no limits on ACT, that individuals receive those services as long as they are medically necessary for those services. In terms of the billing during the period of time someone is temporarily admitted to a hospital or is incarcerated, the department notes that a reimbursement during those time periods would face obstacles for federal approval, as you've heard in consideration of other bills this session. Information from Spurwink and the Alliance for Addiction Mental Health Services indicates that following the client is integral to the fidelity to the model, and that this would be assisted by a per member per month rate in order to create a plan that would address the patient's needs. And then finally, with regard to the rule directive about medical eligibility to receive services, the department was looking for clarification, I think, of the intent of that provision, because currently few diagnoses are excluded from the eligibility criteria. From Spurwink and the Alliance, we received information and testimony that act as evidence-based only for certain diagnoses and circumstances, not any patient who might have complex needs, and that currently, or specifically rather, that schizophrenia, schizoaffective disorder, bipolar disorder, and major depressive disorder, as opposed to personality disorders, developmental disabilities, or substance use disorder, as a standalone diagnosis, would be the diagnoses that would be evidence-based to receive ACT services.
Thank you. Any questions of that analysis from the committee? I'm not seeing any. So a number of issues were raised. One was the extension from 6 months to 12 months for rulemaking. Another was whether directing the department to come up with a PM, or whether it might be a matter of considering it. And then there were several elements that may or may not be necessary. Does anybody want to speak to any of those pieces? And there was the 1-year certification with annual renewal, which is different than currently and would save some work. And the issue about whether if we extend the time, you really need the emergency clause or not. So those are the issues that I can identify. Does anyone want to speak to any of those? Representative Perry.
Two things. I think we need to extend the time. We've got to have the time to do the work that needs to be done. And the other piece of it is also the 25%, which we have done with all of our mental health to maintain that.
Yep. And that would, the earliest that could be done would be the start of a quarter. So if this was to get passed in June, we might make it retroactive to April. Is that right? Oh, if it goes into effect in July, then we're really only talking about that quarter. Maybe Aaron can help here.
Yeah, that would be the reason for the emergency clause.
Yeah.
Right. So in order to receive federal matching funds, if this is something that the department needs to submit a waiver or state plan amendment, I think the rates can only be retroactive to the quarter in which, or prior to which, the department submits that request to federal CMS. I don't know if this is one of those rates that would require that. Maybe the department has more information.
See that Molly can join us shortly. Good morning, Ms. Bogart. How are you doing, Molly?
Good, how are you?
And the question was asked about time frame for a 25% increase to the ACT teams. and extending that rulemaking out to a year for this work. Any thoughts about what you've heard so far?
Sure. I do want to note Dr. Pollard is in the waiting room, I believe, and she may be able to speak to this too. But as we've talked about a number of times, that rulemaking takes a while. I think probably a year is a reasonable goal, but the 6-month timeline is certainly a challenge as drafted.
Okay. And does the department read this as directing it to come up with a PMPM or to consider it?
Our understanding was that it was a directive.
Okay. And then maybe we can hear about whether that's the intent or not, whether we're already lined up with something that's to be happening anyway. And okay. Any other thoughts? Any questions? Do we need clarification of anything? We can, or I think we've considered and heard this bill that fits in with the 25%. And it's the sponsor's intent to come up to generate a PMPM. So are there any other comments people want to make before we entertain a motion? I don't see any, so I'd entertain a motion. It's one. Representative Stover. You're on mute, Representative Stover.
I was going to make the motion if we're ready.
Feel free.
I would make a motion that we accept this with the amendments as you have outlined.
So yes, there's been a motion. Is there a second?
Second.
Okay. So the amendments we've heard about is extension from 6 months to 12 months. That's the biggest one. It's unclear whether 5.2 and 6 are needed according to the department in the numbering on Aaron's analysis. Any thoughts about either of those? Yes, Aaron.
I'm sorry, I'm a little confused about what the amendment is. So I have the directive to direct the department to adopt a per member per month rate within a year.
Mm-hmm.
What are the other ones?
We're still discussing at this point. And if you'll put up your analysis again, I'll point out the questions that I asked.
Okay.
And whether anybody wants to make any changes such as deleting 5.2 or 6 in your bullet points. So if we go to section 2, the issue is whether there's an active limit or not. And it doesn't sound like that there is. So I wasn't sure why we needed to include that. And I don't know where the informal service link come from, but the department doesn't support that. And then the other question I had was about section 6 that you have on your analysis, where it says that ACT is supposed to be following evidence-based practices. That sounds like that's already in place too. So I just want to ask about that. Representative Griffin, did you had your hand up?
I guess I just wanted clarification from the department on how they feel about this bill, and amendments.
So we can bring in Ms. Dr. Pollard. Are you out there? You are out there. Okay. So she'll be in shortly. Dr. Pollard can answer a couple of these questions. Welcome.
Thank you. I'm never going to get used to that thing where it shuts you off and pulls you in like you're getting pulled into some kind of portal.
We refer to that as the wormhole. Or at least I do.
That is a good description.
So a couple questions been asked. Sounds like there's sentiment to move it out to 12 months in terms of the rulemaking. Is the plan for a per member per month? Is that part of your thinking already? And it just codifies that?
I think we are certainly interested in the PM. I do want to make a couple of notes. I think there are some, I think if it is requiring a PM, that can potentially be problematic in terms of limiting our flexibility for other potential solutions that we have in mind. And if it's fair to note some other, to provide some other feedback about the bill, I would be happy to do so.
Sure. Please feel free to chip in what you've heard in response to Aaron's note or the motion.
Yeah, so I didn't realize that this was a question in advance, but I just took a quick look at the last 2 years worth of licensing data to one of the questions that were asked. We did have 9 ACT teams that stopped providing ACT in the past 2 years, but 2 of those were due to moving service location, not actual discontinuation of services. So quick math tells me that's 7. And then we had 6 new ACT locations in the past 2 years. So I think it's always important to look at it in context. So we had 7 cease and 6 start in the past 2 years. I think you asked for a longer time period, but I did not have that at my fingertips.
That helps.
Yeah, I think there are some really useful parts of the bill about increased flexibilities for staffing. That's something we're interested in as well. The statutory language as it currently exists is limiting on some of the things that we would like to be able to permit in rules, such as a physician's assistant in the prescriber role, if that physician's assistant has psychiatric experience. So we appreciate that aspect of the bill because of our challenges around workforce. That particular component, we think, for the medical assistant and PA flexibility would be really helpful. I can absolutely confirm there is no such thing as an informal limit as long as medical necessity is met. There is no time limit on how long someone can be in ACT. We have some concerns about the length of time for between authorizations being an entire year, not because we want to create administrative burden. I think a longer time period between authorizations is reasonable, but an entire year does not give us then the opportunity just to re-examine that the service continues to be necessary in what would be, I think, a more reasonable time frame. So we definitely are open to expanding the time between authorization, but a year seems too lengthy because we do, of course, maintain a recovery orientation that is possible and expected that people can improve with the right supports.
So would 6 months be acceptable, or are you thinking that's too long too?
I mean, we had not sorted that out in the rulemaking process yet in terms of exactly how long, but I think that's, I mean, that would be more in line with what I think would be a reasonable interval.
Okay.
I think there is also a potential loophole here that I want to call people's attention to. Loophole is the wrong word, but an unintended consequence, which is there really is quite a bit of flexibility in what's allowable for meeting the 3-time-a-week average for the service. The specific language about street outreach being an unlimited component of how somebody could achieve, a provider could achieve the 3-time-a-week minimum. It causes some concern because in theory, that could mean a provider might not actually see a patient at all. And if this bill passed as written, could be billing up to daily for somebody that they were not physically seeing in any way for the entire authorization period. I don't think that that is the intent, but just as written, that would seem to allow that. And so we would suggest some different language around the that particular section. I think there is already a lot of flexibility about outreach and closed door contact. I have to express confusion about the both PM and 25% because people may be aware that this rate is a per diem rate. So as it stands now, some providers may be billing 3 times a week, 4 weeks out of the month. Some might be billing 5 days a week, 3 times a month, And it's not entirely clear how that math is supposed to work in terms of conversion of a per diem rate to a PM and when or how that 25% would be applied. I think you will not be surprised to hear me say that our strong preference is for us to engage in appropriate rate setting methodology. And as is our plan. And that, again, we think PMs are great, but don't want to be restricted in statute because there are other potential solutions to this.
Thank you. Thank you. Mallory Shaughnessy, you want to contribute here?
Hi, thanks. Yes, I appreciate the comments, Director Pollard. Excuse me. There is quite a bit of flexibility currently within the regulations, but it is tied to this 3 times a week. And there's also, I think about 1.5 years ago, some strange changes were done to rules that created this 21-day max in a month, kind of a ruling around the capacity to bill, which has gotten very confused. And so what we're hoping to move to is just a straight per member per month wraparound, because the fidelity of the model of ACT is really a wraparound service, and a PM lends itself much better to that than a daily rate or a fee-for-service type of a situation. The situation that arrives is we do hope for recovery. We do hope for people to move into a more stabilized place. But if you have to still meet with them 3 times a week to be able to bill, you can't give them a little bit more time away before you check back in again. Whereas in some situations where it's more intensive need, you need to meet with them daily. So we wanted a little more flexibility in that capacity averaged over a longer period of time, to say that there are more intense times and there are less intense times when you're trying to move them into more independence. And that's sort of the reasoning for that. There was some, I'm trying to think of the other pieces that we were talking about. The capacity to be able to follow them into or out of a hospital situation is really critical, because there are planning needs to bring them back out. And if you're excluded from the treatment team in the hospital as they're making that plan, it doesn't allow for a better transition back out again. Same with jail. If somebody ends up in jail, they need that capacity to work with the staff to bring them back out, into a more stable situation. So there's definitely some pieces in there. I know there was a question around the piece about eligibility. And one of the things is that ACT really is designed for a situation where there is more intensity of need and more sort of a psychosis aspect, schizophrenia, schizoaffective disorder, bipolar or major depression with psychotic features. Whereas what we have found sometimes, and this is a beautiful thing that is happening in that we are developing more intensive outpatient mental health service lines, which would be more appropriate for some other diagnoses. We have seen a number of people that have a higher mental health acuity put into ACT programs because there wasn't anything else available. And so we don't want to, as we're opening those other intensive outpatient service lines, we'd like to say, let's bring ACT back to what its fidelity was, what is intended for. So that's where that language sort of came from.
Okay.
I'm trying to think if there was another question that you had that I need to answer. Quite a lot of things. 6 months would be great. Something more than just the every 90 days. We do hope for recovery. We do hope for more sustainability, but it is a chronic brain disease, and having a little bit more length of time before having to go through those paperwork and all of the process would actually be helpful. And was there something else that you had questions about?
I was going to ask you if you had a chance to meet with the department over the last year or so about those somewhat, quote, odd rules, not a term I would use. Have you met with the department about those?
Sorry, we did meet with Michelle Probert when she first came on and shared some of those concerns. I could actually get you some write-up on that if you want. I didn't have that prepared for this.
Where I was going was, would this be something that could be done as part of the, could be addressed as part of the rulemaking process with input from
Yes.
stakeholders? I don't think,
Yes.
yeah, I'm saying it, I don't think that piece necessarily needs to be in legislation.
No, but the piece that we were hoping in legislation was the move towards some sort of a wraparound per member per month.
Right.
And if possible, the rate increase on a more, what we were hoping for is a rate increase now based on the way it is currently done as we move towards a different method of billing. I think that was sort of the intent of the legislation as it came forward.
Okay, so my question is going to be, will we accomplish what we want to by changing the word create to consider, or from provide for to consider a per member per month reimbursement model to ensure?
Yeah, and maybe even language around, you know, a more wraparound. Oh, I don't know how. Yeah, I would just say that would be good.
Okay, let's just put that. Dr. Pollard, did you have any response or thoughts to this?
Yeah, ACT is like this, the rules around ACT are like some kind of bad penny. I think we need to just get some kind of neon sign with simplified ACT rules. The 21 day a month is a misunderstanding that is not correct. There is no, we do allow for even everyday billing. It's just that the default authorization is up to 21 days a month, but providers can certainly say, we think it's medically necessary to see somebody more than 21 days a month, and then authorization can be granted for that. And just to make sure, I think it was clear in the OPLA analysis, but there's no prohibition on ACT teams participating. In fact, that would be appropriate clinically for their role in terms of, you know, care coordination when somebody is hospitalized or otherwise in an institutional setting. It's just that federal rules prohibit us from reimbursing when somebody is in that kind of setting. So just know for consideration of fiscal that would mean it could not have a federal match.
And I would just add that this is where one of the problem lies, is that the rate as it is doesn't fully cover the doing of the service, the providing of the service. And so when you have to do more service that you don't get any billing for, it cuts into what you already are not making enough of.
That's what your argument for the PMPM or
an increase in right now. Yeah.
Yeah. Okay. Thank you. Representative Stover.
I just thank you, Dr. Pollard. I had a question. You had mentioned on what in the bill I would call number 5, the clarification of the minimum contact of 3 times a week, and then the whole language around closed door outreach. Is there a way you think that statement could be work better for you? Like, for instance, clarify the minimum contact requirement is 3 contacts weekly on average over each year of authorized service, and that contract may be face-to-face. I mean, doesn't that already exist?
Yeah, that is already, I think there's just a lot of misunderstanding of the rule, but that is how it already, it's on average 3 times a week, and there's pretty significant flexibility there.
Based on medical necessity, as you said, correct?
Mm-hmm.
So we could hear in January about how the conversations went to get rid of the odd rules and make sure communication is consistent as part of the rulemaking process.
Yeah, if there was some kind of like, you know, we could erase people's memory of past you know, like what used to exist, and just say, this is how it is now. That would be helpful.
But we also don't need to do that in legislation.
I don't know how you do it, but if you have that statutory authority, that would be helpful.
We'll be looking for that magic wand, yes. Representative Zager.
Thank you, Mr. Chair. Director Pollard, I appreciate you clarifying the 21-day default. Is that a federal or other reasons why that default exists?
I don't think it's a federal reason. I think it's just based on kind of average utilization or expected utilization. We don't want to, you know, it's sort of a threshold for estimating what's a reasonable amount of the average utilization. And then there are, of course, exceptions to that. If somebody has a more severe impairment that would necessitate a greater need. So I think it's our attempt to balance allowing enough but not opening it so wide open that people who didn't necessarily need that much wouldn't be subject to a little bit of additional scrutiny for such a high level of utilization.
And I think,
did I say that in a terribly unclear manner from your expression? I think.
I don't know. Well, I think I understand what you're saying, but as the committee considers like per member per month or a per diem kind of model, it's perhaps that 21 days is arbitrary. Maybe it's not arbitrary, but it's some sort of like watershed where like, what are your thoughts about removing that so that there could be more free flow and less administrative burden?
I mean, I would want that to be based on some kind of evidence. I mean, I think on average, we're talking then about somebody being seen a little over 4 days a week for service, which I don't think is the typical expected utilization for ACT, but I would want that to be based in more than just kind of some assumptions. I think there are really good utilization studies that exist, as well as outcome studies that show kind of a good minimum dosing that we'd want to base that on, as opposed to having it just be, every 7 days a week being automatically approved for everybody.
Well, I want to hear what Mallory has to say, and then we'll go to hear from Mr. Pickering.
Yeah, so I think you're getting, Representative Zay, you're getting at sort of the issue that we have is that we do need more flexibility, because there are times when somebody's in an acute situation where they're seen twice a day, every day for a week, or maybe a little bit more, and being touched base with. There are other times where they are doing better, and we're trying to help sustain, the provider's trying to help sustain that independence, and seeing them maybe once in a week and then checking back in, and maybe twice the next week, or 3 times or 4 times, depending on how they move, but having more flexibility and less prescriptive. I know the minimum dosing is kind of a nice thing, but when you average it over a longer period of time, as we're trying to suggest, it just makes it easier to actually meet the needs as they present. And the documentation of the treatment notes would show that. The need and or the need to be able to step back a little bit.
So we could add to the consider language the option, consider ways to make the visits more flexible, visit timing more flexible.
Even doing, if you wanted to move to the prior authorization for every 6 months rather than the year we proposed, that would be better than the current. And maybe say averaging within the 6 month rather than averaging over a year. Again, that gives more leeway within that 6 months as somebody moves in and out of an acute phase or not.
So we're pretty well into the weeds at this point for a policy committee. And is that something that could be addressed in conversations in the next 6 months, before we hear a report back about how much progress is made, and consider whether we need some of this legislation?
I would think the prior auth piece and the averaging might be something that would be added, but I'm not sure if that's too far in the weeds. Maybe Aaron could weigh in on that for the weed factor.
I would just say I don't think we need legislation in order to do it. I think we are open to reasonably reducing administrative burden. It's something that we're trying to spend some effort on as well. I really think, just to reiterate, that the statutory change for staffing is important, and something we don't have the authority to change without your assistance.
Yeah, that's a real important. Thank you.
That I don't hear anybody debating whether we should keep that part or not. I think we if it helps you with your flexibility, then that's the goal for the department, but more primarily the patients. And then I did hear some sentiment for the 6 months for renewal as being helpful by itself. So maybe the request is that you continue the work for paperwork reduction or administrative burden, and in conversation with key stakeholders, and then let us know what things look like in January for the other elements. Representative Meyer?
Thank you, Mr. Chair. Yep, perhaps some of those conversations, the content of some of those conversations could be in a letter as well.
Okay, yeah, we could do that. Representative Stover? When you're unmuted.
Sorry. And based on that, I'd like to respectfully withdraw my motion earlier.
You want to withdraw the ought to pass as amended?
Yes, because we've changed the language.
Yep.
And moving in a different direction with the letter. So I think that would be appropriate.
Well, I think, as I understood Representative Meyer, it was the legislation and a letter.
Yes.
The
Not-
legislation and a letter.
Yes.
But in my motion, we hadn't changed to the 180 days over the 90. Would I have to do another amendment?
Well, that's the discussion we're having now. What belongs in the amendment category
So
and
I'll just leave that where it is for the moment then.
for 60 days, for 6 months.
Yeah, the 180 days, yes.
Yes, so that would stay in as amendment, and the 12 months for rulemaking would stay in as amendment. And the general tone would be, rather than stipulating a PMPM, that the department consider a PMPM as a way to ensure. Those are the three things that I'm aware of that would require amending.
Well, I think Dr. Pollard said that statutory change in the positions would be helpful.
But that's already in the document.
Okay.
Yeah, so that would go, the bills, it's already in the bill.
Okay. As long as we don't have to.
Okay. So any additional conversation? We didn't hear from Mr. Pickering. Do you want to join this discussion, sir? Joe, did you want to unmute and join us? I saw your hand up a while back. Joe Pickering, did you want to unmute and join us? Well, he's here in spirit. And so in the absence of other discussion, there's a motion on the floor. Representative Stover, is your hand still up? And the motion's still good, ought to pass as amended with the amendments we discussed. I don't see any further discussion, so.
I would second that.
Okay. Darlene, can you run the vote? On LD 582. You're muted, yeah.
Representative Zager,
Yes.
Representative Lemlin,
Yes.
Representative Stover,
Yes.
Senator Baldacci is absent. Representative Perry,
Yes.
Representative Griffin,
Yes.
Representative Connor,
Yes.
Representative Craven,
Yes.
and Representative Madigan, absent. Representative Javner is absent. Senator Moore,
Yes.
Representative Mayer,
Yes.
and Senator Claxton.
Yes.
Okay, that would be 10 in the affirmative and 0 in the negative. Or in opposition,
Yeah, with 3 absent.
3 absent.
Good. Aaron, yes, you have permission to work with the department to clean up the language, but you have another.
That's not my only question. I'm sorry. I admit I am confused about what
Okay.
you just voted on. So what I'd like to do, if possible, is go through the bill and then just restate my understanding, just so that we're entirely clear now.
Right. And I forgot to touch base with you before we voted, and I apologize. Go ahead.
No, that's okay. Okay, so we're keeping the emergency preamble.
Yes.
Okay. We are making the statutory changes to the definition of assertive community treatment and adding in the definitions of medical assistant and psychiatric provider and adding those to the multidisciplinary team, right?
But that's already in the language, right? We're not adding. to
We're
that language.
keeping it. We're keeping
Yeah,
it. That's
keeping
just,
it, yeah.
I'm just going through the whole bill.
Yep,
So
yep.
you're directing a 25% increase to the current act rates under section 17 to take effect as soon as the bill takes effect.
Yes.
Okay. This is the rulemaking piece is where I got turned around. So instead of requiring the department to use a per member per month payment model, you're moving a request to the department to consider that payment model to a letter.
I was just going to change the words provide for to consider.
Do you need a directive and an unallocated language to do that? Or do you want to put that in a letter with other directions to consider and have conversations?
Is that reasonable to put in the letter that you were thinking about, Representative Meyer? Yeah, yes, that's fine.
We're removing the language about rulemaking that have to do with any kind of limits on ACT services based on the information you receive from the department. So that would be 5.2 is being removed.
Yes.
In terms of this is 5.3, the initial authorization period, is that for 1 year or is that for 6 months and then 6 months thereafter, or to have conversations?
6 months and 6 months, the way I understood the conversation. And I'm trusting the committee to correct me if I'm misstating any of this.
The billing for services under the program for coordination of care during an initial engagement period of 90 days when someone is admitted to a hospital or incarcerated, are you keeping that or are you removing that?
That goes in the content of the letter because it's related to the PMPM.
So to consider the adding ACT teams to transition planning or something like that.
Yeah.
Okay.
Or enabling them to participate in, or encouraging them.
Under 5.5, the minimum contacts, the 3 contacts a week on average, that's going into the letter to have clarification conversations. Is that correct?
And to improve flexibility and decrease administrative burden as possible.
Okay, and then 5.6 about medical eligibility to receive service. I'm not sure where you landed on that.
My understanding was that it wasn't really necessary any longer, since that's really what's the intent. I heard a voice or a sound here. Senator Moore, did you want to chip in at this point?
I just was going to point out to Aaron that in that first paragraph of section 5 in the rulemaking, we're changing that from 6 months to 12 months for them to do the rulemaking.
Well, so I thought you were so that's a directive to do the rulemaking to change to a per member per month model. And I thought that you were taking out the directive so that we don't need a time limit anymore. And that's going into a letter.
That's correct. So I guess we don't.
So they wouldn't really be specifying a date because they'd be reporting back in January about those discussions that they were considering the new model.
Okay, so there would be no, in a sense, rulemaking necessary. Is that what we're saying?
Except to the extent to implement the 25% immediate rate increase based on the current model, I believe.
Okay.
With some ongoing discussions.
Yeah. Okay.
About how to accomplish the PM or how to consider the PMPM.
I had just was putting that because I had written down the 12 months. I gotcha.
Okay.
Thank you.
You're all set then? Okay. I see a hand up. Ms. Shaughnessy, is your hand up again?
It is actually. In going through that, I think Senator Moore was correct that the 6 months was to 12 months. But I thought that there were a couple of those pieces in rulemaking that were going to the authorization period. I thought
yes, we captured that at 6 months, and renewal was 6 months.
Okay. 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 It's as long as that was captured. I thought that if you eliminated all of the rulemaking to a letter, then it wasn't captured.
No, we put the most flexible portions of the rulemaking conversation in the letter, the more flexible, and we stipulated the 6 months as understandably important.
Okay,
and-
thank you.
And mutually helpful. All right, I'm sorry if I confused that process, but I should have started with Aaron earlier. That's always a good rule. All right. So with that conversation wrapped up, we should move to consideration of LD 745.
Okay, LD 745 is an act to strengthen Maine's public health by expanding access to certain health programs and services. The bill was originally came to us as a concept draft, and prior to the public hearing, the sponsor proposed language, which is posted to our electronic LD file. I'm sorry, I forgot to add the link in there. Amending the Universal Childhood Immunization Program in the following ways to be effective September 2022. So it would change the name of the Universal Childhood Immunization Program to the Universal Immunization Program, and therefore increase the scope of the program from all children from birth until 19 years to all persons receiving health care in the state. It defines adult to mean a person between 19 and 64 years of age. It changes the frequency of meetings of the Maine Vaccine Board, and it amends provisions about assessments on health insurance carriers or third-party administrators under the program in relation to the addition of adults to the program. You received a number of questions posed by people who testified about kind of the timeline and the scope of vaccines and clarifying the assessment methodology and what happens with uninsured adults, et cetera, that perhaps you could request more information about from other people if you needed that. Maine Association of Health Plans suggested as an alternative asking the Maine Vaccine Board to look further into the issues generated by this proposal and come back with an analysis and possibly a proposal for the committee's review. The committee had requested that someone from the CDC and former legislator Gary Connor be present at the work session. You know that Representative Connor was invited. I have not heard if he's here. I don't know if he's in the waiting room, but I think someone from the CDC might be here. And you don't have a fiscal impact statement yet.
Okay. So Representative Perry, you had your hand up.
Yeah, I did. And I admit that I was there when Representative Connor actually did the negotiating around bringing forth the Childhood Vaccine Board. And it was done with a great deal of negotiation with all parties, and all parties were in agreement. And looking at the CDC's proposal, I really like the idea of the vaccine board or what they had proposed, really doing a real deep dive into accomplishing this and coming back to the committee with a proposal.
Any other comments? I'm not seeing any questions. So you're talking about turning this into a request that the Maine Vaccine Board develop a plan that will be in the form of a resolve, really, and that they come back to report to us in January about what that would look like. Is that what I heard?
Yes.
Okay. How does that sound to folks? Any questions about that or concerns with that approach? I see the sponsors here. Representative Millette, welcome.
Good morning.
Good morning. So how would that work to give the vaccine board 6, 7, 8 months to come up with a plan and then let us review it in January?
Thank you, Mr. Chair. First, I'd like to let folks know that Mr. Connor is in the waiting room under my name
Oh, well,
because he never received a link to the meeting. So if folks would like to hear from him, he is available. Secondly, as the bill is drafted, the Maine Vaccine Board is the one that makes the decisions about how this is implemented. They're the ones who choose the vaccines. They're the ones that decide what the assessments are. And in recognition of all that's on everybody's plates, the implementation date of this bill is pushed out over 1.5 years. So I was absolutely sensitive to the fact that this would require some work on everyone's part.
Okay. And I do see that no longer under a pseudonym. Welcome, Honorable Gary Quanner.
Thank you, Mr. Chair. And it's great to be back with the committee that I once sat upon. So, and thank you to Rebecca for getting me in. And if I did get a link, I apologize that I missed it. So thank you. I'm happy to answer any questions. I think my former chair made a potential motion that could be something we could work through.
We won't hold that against you. So that is something that you can go with that would be acceptable both to the board and the affiliated stakeholders which are represented on the board pretty well as anybody else that you'd need to include. Okay, because we did have a number of questions come up that deserve attention. Okay, so I take it that, yes, Representative Millette.
Thank you, Mr. Chair. I just want to make sure that the language includes that the committee is authorized to report out a bill.
We call that the Perry Amendment, that we get a report back and have the option to create a bill. So since she made the motion, that would be included. But yes, thank you. We'll make that specific.
I make a motion, it's an automatic.
All right. So what I heard was there's a motion on the floor. Honorable Connor, do you want to say something?
Yeah, thank you, Mr. Chair. And I apologize because when I got pulled into the room, as you know, you go out for a minute. So as I understand it, Representative Perry would send it to the Maine Vaccine Board and we would kind of study these issues and come back with a recommendation. I'm assuming it would authorize us to include Representative Millette or any, the department, for example, to seek their input. So just I guess I want to broaden it to make sure it's not thought that it will only be done at, the next Maine Vaccine Board meeting. And then if we don't come up with something, we don't come up with something. It's really more of a resolve for us to almost form a little group. I want to avoid you having to pay per diems. So.
You've been here, done that, right?
I served on appropriations. No.
Okay. So that's the way I understood it, that it would be on it would be the responsibility of the board to come up with a plan. And that to me is carte blanche to include anybody else that you need to pull into the process and to encourage you to pull into the process. Those you need to be successful to come up with a good plan. Is that broad enough prescription? Okay. All right. Back to Representative Perry. You made a motion.
I did now, yes.
Okay. Ought to pass as amended. The amendment being the institution of referring this to the step of referring this to the Maine Vaccination Board to develop a plan. Is there a second for that motion?
Second.
Okay. Erin, you had your hand up.
My question is about timing. In order to actually have the vaccine board to have 6 months or so to develop the plan, you would need to add an emergency preamble. Otherwise, this doesn't go into effect until October. And so you'd have 2 months before that they would have to work on it before bringing back something to you in January.
Let me ask Representative Connor about whether you would just go ahead and start on the work now anyway, independent of the October official start date.
Yeah, I think that, fortunately, this has been a topic that the board has discussed previously. And I want to actually be very clear that I'm not actually here representing the Maine Vaccine Board. I do serve upon it. I helped establish it more than 10 years ago, but we haven't taken any official action on the bill. I think many of the members, absolutely support this in principle. So I think that we would be happy to start those conversations, in advance of formal meetings. And so I think that what I heard Ms. Dooling say, we need to be ready basically in the next, we have about 5-6 months to get you a plan. Is that what I heard?
Yeah, that was the concern that was raised. Representative Millette, do you want to make a case for an emergency clause?
I do not.
Okay.
I make a case for no emergency clause and trust the fact that members of the Maine Vaccine Board I've had conversations with are interested in doing this work, and that it will proceed with or without the emergency. Thank you.
Representative Limlin.
Yes, thank you. What type of vaccine plan are we talking about? I'm a little confused.
Well, as I understand the process now, the board considers the range of immunizations, vaccinations that are available, and then selectively and based on whatever is in statute, makes those available. Does the board make available every vaccine at the reduced rate, Mr. Connor?
Yeah, so in principle, yes. I think we basically, for the ACIP, which is the federal government's role in saying what are the recommended vaccines for children, each year they put out their list. Sometimes there will be multiple vaccines for a particular disease, and the board will sometimes say, okay, we're only going to offer this one versus the other. That's usually based on cost and some other factors. Typically, almost all are always approved from that list. But the bottom line is, for every preventable disease that's out there that a vaccine is available, we will have at least one vaccine available on that list. For adults, the list is much, much smaller. And so it's a little bit easier to address. And I think Representative Millette may want to speak to that, seeing that her hand.
Just to clarify that point, to make sure we get to answering the question that Representative Lemlin has asked, those are vaccines that are offered at a reduced rate to the prescribing provider. Is that accurately stated?
Correct. Just to give you the quick answer on how the whole board works. 10 years ago, and Representative Perry was there for these conversations, as was Representative Craven, I think then Senator Craven. We basically go out, the CDC, the Maine CDC goes out and buys all the childhood vaccines for the entire state of Maine. There are some federal dollars that also support that. And then we make those vaccines available in a universal way to all prescribers, all physicians throughout the state, so that they don't have to have a public supply refrigerator, a private supply refrigerator. It's just one big supply, all purchased at a lower cost. And it's available to every doc that's in the system, if you will.
And they stock their refrigerator based on the vaccines that they opt to use in their practice or make available to the patients in that practice.
Correct.
Okay. Representative Lemlin, is that, are we getting close?
You're getting close, but I guess my concern is it sounds like you're already doing this. So what would change with this?
I'm happy to defer to Representative Millette. I want to be very respectful of the fact that I no longer earned a seat like all of you.
Representative Millette?
Thank you. Yes, this is about, so currently the program is for children only. This bill seeks to add in the adult population. And to be clear, this bill does not prescribe vaccines. That's the decision of the Maine Vaccine Board. So I think it's important to think of this not as a vaccine plan, but rather an implementation plan to include adult vaccines in this purchasing program. It's a very narrow field that we're dealing with. Thank you.
Does that get closer to what you were looking for, Representative Lemlin?
Yes, it does. Thank you, Senator.
Representative Zager?
Just for clarification, thank you, Mr. Chair, Representative Mellon. It would enable us to save money on vaccines for adults. Is that's the crux of it, right?
That's correct.
Thank you.
Okay. All right. So there's motion on the floor, ought to pass as amended. Let me go to Aaron before I say anything else and not get in trouble again. Do you have adequate clarity?
Yes, so I understand we're converting the bill to a resolve that would direct the Maine Vaccine Board to convene a stakeholder group to examine how adults could be brought into the current universal immunization program.
And
for the
report
purpose
back to us in
and
January.
report back in January with the Perry Amendment.
Very good. Thank you very much. So that's an adequate summary for everybody. Are we ready to vote? Not seeing any other hands up, then we'll go back to Darlene.
All righty. Representative Zager.
Yes.
Representative Lemlin.
Yes.
Representative Stover.
Yes.
Senator Baldacci is absent. Representative Perry.
Yes.
Representative Griffin.
Yes.
Representative Connor.
Yes.
Representative Craven.
Yes.
Representative Madigan is absent, and Representative Javner is absent. Senator Moore.
Yes.
Representative Mayor.
Meyer.
Meyer. I'll get it right by the end of the day.
Thank you, darling.
Senator Claxton.
Yes.
10 in the affirmative, 0 in opposition, and 3 absent.
Thank you to the sponsor for being here and helping answer some questions and bringing this forward. It's a good step. And glad you could join us, the Honorable Gary Connor, to help us through some of this too. And we'll expect chocolate if we're ever back in real session.
Well, it is important to note that if you read my testimony, I did reference that fact. So this isn't my first time back to committee, but if we were in person, you can bet there would have been some treats along and maybe even a bottle of something in the old appropriations room. I kid. So thank you, everybody. Appreciate your support.
Thank you for being here. Some of the traditions shouldn't change.
That's right.
All right. That gets us to LD 1601.
All right, LD 1601 is a resolve to establish an advisory panel to study the implications of genome editing technology for all the citizens in the state. And so it would establish this advisory panel to study the implications of genome editing technology and legislative, administrative, or other steps that Maine should take to capitalize on the potential of this technology while avoiding the hazards of it. It's required to be staffed by legislative staff, and it's directed to submit its report, including suggested legislation, to the first regular session of the 131st legislature. Membership in the advisory panel includes legislators from both parties, a bioethicist, a person under 30. I guess that because you can't trust people over 30, which I think is what people used to say back in the day. A member who is of the Wabanaki people, a member who is a fiction author or poet, a person living with a single gene disorder, and other members with various relevant expertise. It includes an invitation to the Maine Judicial Branch and the governor to participate. To accomplish the duties of the panel to study these issues, it's required to solicit testimony, advice, or participation of persons having relevant background or expertise in ethics, clinical medicine, public health, bioscience research, environmental protection, forestry, agriculture, aquaculture, fishing, state economics, tourism, business or commerce, military or security affairs, and also the University of Maine system or the Maine Community College system, a person living with a single gene disorder or that person's parent or guardian, hospital or hospital chaplaincy, and someone with a history of race, ethnicity, or eugenics. And you heard at the public hearing that the University of Maine requested the ability to serve on the panel as a member of the advisory panel. In terms of membership, currently it says a member of a person who is of the Wabanaki people. My understanding is that Representative Newell, in regard to other amendments with members of federally recognized Indian nations, tribes, or bands in the state, and then that's how those groups have been referred to, and that's consistent with other amendments and consistent with how the statute reads right now, generally. You had information about what other states have done, and obviously I haven't done as much as Representative Zager, but when he mentioned that Washington and California had some related legislation, I just hyperlinked those bills to you. California for certain gene therapy kits, but in Washington, it is about creating a study commission to review genome editing implications. And the fiscal impact hasn't yet been determined yet. I did want to note that, as we've discussed before on legislative studies, and those are studies that use legislative resources, there's Joint Rule 353 that specifies requirements such as the number of members, the date of the report back, whether legislative staff can be used, and some other elements. But this, as drafted, it specifically notwithstands that rule, because in particular, I think the number of members on the advisory panel and the report date, it provides another year beyond what would normally be required. So I think that all studies go to the study table anyway. I think this just would require an extra step to be approved by the POs because of its non-compliance, particularly to have legislative staff like me be able to staff this advisory panel.
Okay. Comments, questions from the committee? This is a relatively new topic area. We haven't spent any time really just exploring it, but it's out there, and this is an attempt, as I understand it, Representative Zager, to further the conversation. Okay. Does anybody have any? Yes, you have your hand up, Representative Perry.
Yes, I look at this as an opportunity to really take a hard look at science that's already happening and give us an opportunity to really get a handle on what we should be doing and what we should be restricting. It's going to happen anyway, but it gives us an opportunity to really put some parameters around this. So not hearing much discussion, I'm going to move the bill.
I second that.
So it's been moved as ought to pass. Is there additional discussion? Yes, Representative Zager.
Thank you, Mr. Chair. I certainly defer to the committee's preferences. I just want to, if I may be permitted to mention a couple of things. One is I don't know what the cloture deadline will be at that time. So 12/31 might be past the deadline, and so if something were to be submitted in the 131st, perhaps the committee might consider moving that to 12/1, December 1st, as a simple, friendly amendment. Also, based, going off of what Representative Perry just mentioned, indeed, this technology is here to stay. That's not my words. That's actually the words from the former chair of the Christian Medical Fellowship, Trevor Stammers. I made a particular explicit intended to include the importance of all sorts of perspectives in this proposal. Among the people that testified, there was not much much testimony from leaders in the faith community in Maine. So I went out and looked at what, for instance, the Vatican has published on it in their directory for catechesis. The Vatican talks about how genetic work along these lines has potential. And that it's lawful as long as it promotes the good of the person without affecting the person's identity and integrity. The Vatican itself actually has held a conference on Huntington's disease, and as this technology pertains to it, Huntington's disease is a dementia-producing, awful inherited disease caused by a simple gene distortion. I talked to faith leaders in my community, my district, as well. One faith leader told me, an ordained faith leader, this is a conversation we have to have. And another put it this way, this was Reverend Ludwig, an ordained minister in the United Church of Christ, said, speaking for herself, that I do not believe that faith, religion, medicine, and science stand in opposition to one another, and specifically said, I therefore believe it is important for the state of Maine to establish and support an advisory panel that will investigate, study, and discuss the moral, ethical, medical, and scientific repercussions of gene editing technologies in efforts to ensure that such technologies are developed and used in ways that benefit humanity's well-being and wholeness. I completely agree with the good Reverend. I would really appreciate the committee's thoughtfulness about this issue. It is relatively new in the legislative world. As you can see, tech-rich Washington State is the only other state that is as far along as we are. And so I really appreciate the committee's thoughtfulness on this.
The other way to look at it is the other 48 states are further behind. So with work that they need to do. All right. Yes, Representative Connor.
Thank you, Mr. Chair. I appreciate you allowing me the time, and I appreciate Representative Zager bringing this forward. I too have spoken to several faith leaders in my community, as well as several constituents in my community. And in reading through some of the testimony in opposition of, I personally am voting with those folks that have expressed their concern with this. I understand the reasoning behind the bill, but I just wanted to express that I will be voting in opposition to it for the voice of those folks that I have spoken to that have brought up opposition to it. So thank you for your time, sir.
Thank you. Representative Lemelin?
Yes, thank you. I spoke to the Catholic Bishop's office in Maine, and they advised me to steer away from this also for various reasons. And so I am going to be an ought not to pass also, but thank you.
Thank you. So are there other comments to be made? Not seeing any. The motion on the floor is ought to pass. Aaron?
Just coming back to what Representative Zager said about the timing of the report and cloture. So cloture is about the ability of individual legislators to put in legislation. This bill authorizes a committee to do that. And so the committee would have the authority pursuant to this resolve to put in legislation during the session in which it's receiving that report, which would be the 131st. And it wouldn't be guided by cloture. So, I mean, if you wanted legislators to have the report before cloture, then your amendment's fine. I'm not trying to tell you to change it, but just that they're kind of two separate processes.
Yeah.
I also wanted clarification from the committee on what you decided with the membership in terms of your ought to pass as amended vote.
Okay, let's start with Senator Moore. You had your hand up.
I was just going to point out that I do think that the language in referencing the Wabanaki, that we should use the standard language federally recognized Indian nation tribe are banned in the state. So that would be an amendment that probably should be made to the bill.
Okay. And Representative Zager is sponsored. How do you feel about 1231 as opposed to 12-1 or?
I'm sorry, Mr. Chair, my internet just went wavy.
I
Did
can
you address
see-
me?
Yeah, you froze there. So my question was, how do you feel about 1231 as opposed to 12-1? Understanding that's because the way it's written, the committee can introduce a bill anytime. Do you want a head start on the revisor's office by getting a 12-1 report?
I suppose if the committee can submit a bill, then that would meet the intent of this resolve.
Okay, so that isn't one of the amendments to this. And Aaron, the other question you asked?
I'm good. Thank you.
With that one? Okay.
Yeah, sorry for the clarification.
No, and the use of the standard languages Senator Moore has stipulated. Okay, so those are the amendment portions of the ought to pass as amended. And I guess we can go at this point to Darlene for the vote.
Okay, Representative Zager,
Yes.
Representative Lemlin,
No.
Representative Stover,
Yes.
and Senator Baldacci absent. Representative Perry,
Yes.
Representative Griffin,
Yes.
Representative,
I said sorry, can I say no?
Sure.
yeah, okay.
Sorry.
Nope, that's okay. Representative Connor,
No.
Representative Craven,
Yes.
and Representative Madigan is absent. Representative Javner is absent. Senator Moore,
No.
Representative
Meyer.
Meyer, okay. And is that
Yes.
yes. And Senator Claxton.
Yes.
6 in the affirmative for the motion. 1, 2, 3, and 4 in opposition. Ought not to pass. 3 absent.
Thank you. Yeah, challenging subject, and that's why we have committees, and that's why we have these conversations. So I appreciate that. It feels like it's been about an hour and a half. How do folks feel about taking a 10-minute break and resuming for another hour? Representative Griffin, you had your hand up?
I need to do it. Minority report. Just-
I'm sorry.
That's okay.
I was really interested in getting to the break request before you reminded me. All right, so we're looking for a minority report.
Okay, just an ought not to pass.
Okay, thank you for catching that. Yes, Darlene.
I thought we had 4 people that were ought not to pass. Am I correct?
That's what you told us.
Yeah, that's everybody's.
Yeah, she was just clarifying that.
Oh,
there wasn't
okay,
an
all right.
amendment, that it was on to pass. Thank
Okay,
you.
all right.
Yeah,
I
no,
just
that-
want to make sure it's right.
Yeah, no, the minority report is ought not to pass for the 4 folks who voted. Ought not
Very
to
good.
pass. Right.
Okay,
Nailed
got it.
Okay. All right, so why don't we take a break till 11:40, and we'll resume for another hour before a lunch break. Everybody okay with that? Okay. All right, thank you all. We'll see you back at 11:40.
All right.
So it being 11:40, we can get started again. We're ready to move on to consideration of LD 1077.
Do you want me to start, Senator?
If you would.
1077 is a resolve to promote equity in COVID-19 immunizations. It's emergency legislation and it requires the department to do a few things. In section 1, it requires the department to implement within existing resources and outreach and education program that is tailored to reach rural populations and historically vulnerable populations with information about where and how to receive a COVID-19 vaccine, vaccine safety, and disease prevention. It also directs the department to amend its rules and which are the emergency COVID-19 public health emergency services rules to provide that the activities associated with the administration of COVID-19 vaccines under the main care program are reimbursed to the maximum extent allowable under federal law. And finally, it requires a report to this committee on the progress the state is making in vaccinating state residents with COVID-19 vaccines beginning 7 days after the effective date of this legislation, and then every 6 weeks until the governor's declaration of a state of emergency due to COVID-19 ends. The department raised an issue with section 2 about the rulemaking directive. It provides that those rules would be routine technical. The process under the APA for undergoing routine technical rules is more complex than amending an emergency rule. These rules, I believe, were adopted in accordance with one of the governor's executive orders from last year that suspends certain provisions of the Maine Administrative Procedures Act relating to the adoption of certain rules by emergency. Typically, if the department is adopting rules by emergency, it needs to meet certain requirements. They need to justify the emergency rule, and those emergency rules would be effective for 90 days. And in order to allow the time under the APA to undergo like normal rulemaking procedures. But my understanding of the governor's executive order was that it suspended the time limit of 90 days. And so if the rulemaking directive is that they be routine technical rules, that's a much longer process than simply adopting them on an emergency basis the way that they have been. I think and I think I would want some input from the department on this if you go down this road. I think that there's a way to not withstand the emergency rule adoption provision with the APA and make the rules adopted in accordance with this particular executive order to get around that problem. But as drafted, there is an issue with the process around amending those rules. And you received a number of suggested amendments from the testimony, including one is about the reporting requirements, either tying it to the end of the public health emergency or the end of the federal public health emergency, whichever ends later. And then you received a number of testimony about explicitly including the disability community in the communication outreach portion, as well as various aspects of the report back to this committee portion of the bill. And so I've summarized the details of those suggested amendments from the testimony here that if you'd like, we can return back to in more detail. And then in terms of the fiscal impact, it shows an anticipated $3.9 million in federal expenditures in fiscal year 21-22 and $5.3 million in fiscal year 22-23.
Any thoughts, comments at this point related to that analysis? I don't think Senator Libby is going to join us.
He was here.
He did. He did. So we'll pull him in and make sure Molly's already here. And she can tell us about anybody else who ought to be included. Welcome, Senator. Did you have a chance to hear that analysis from Aaron?
I did. Thank you, Senator. Aaron, could you email that to me?
I can, yes.
Thank you.
And any other comments? Molly, let's hear from you and what the department's perspective is.
Sure, I'm just here if you have questions. I don't have anybody with me for this one, but
Okay. In terms of, well, let's go section by sections. In terms of outreach, I am aware of translations. And again, we have to remember the bill was submitted in November, December, and our perspective may have changed significantly since then. So, Representative Craven, what's your sense of outreach in the communities that you represent?
Thank you, Mr. Chair. Well, at the moment, I think that there is good access. I'm not sure that actually people are taking advantage of the access that's available, but I haven't heard any complaints either. But I know that there's been opportunities for people to have walk-in inoculations, and so yeah.
And I think we heard in testimony that there has been some significant work done with local community groups, which was different arguably than it had been in the early months. So that's an upgrade. Did you get the email, Senator Libby? Okay. And as far as reporting, I think I remember, yes, Representative Craven.
Well, I just wanted to acknowledge in the beginning, just like a lot of other communities, but that there was a lot of angst for, especially in the immigrant community and group homes and other places where people, where we felt that there was a need to do something. I just wanted to acknowledge that that happened in the beginning of the coronavirus. But that it's definitely has slowed down and much access provided now.
Thank you. Senator Moore?
Thank you. And I was going to agree with Representative Craven. I know at the very beginning, there was a lot of concern with that. Having one of the largest counties, or one of the counties with the largest rural population, we've seen so much improvement and the availability, even to the point now where because we have it available at Walgreens, at Walmart, we've actually closed the vaccination clinics in our hospitals because they're not needed. So there's been plenty of opportunities, and I've not had anyone complain anymore about not knowing where they can go or what's available. Even the mobile unit has been to Calais, or is going to be coming to Calais. So I feel like we've done a really good job. And I know this bill was put in, late in the year when it wasn't that way. So I'm really not thinking that we need this bill any longer, because it has been quite good as far as the notification process.
Thank you for that. Any other comments? There were some suggestions to extend to the end of the last, but if that's the predominant sentiment, we could move ahead with that if you wanted to. Senator Libby, did you have any other comments?
No, I'm cognizant you don't want a retake of the public hearing. However, this bill really now is about outreach to that final 50% that we need to get to herd immunity. So I understand there's lots of availability now, but we're talking about rural communities and underserved communities, and the CDC and its partners being adequately funded and required to do that challenging person-to-person outreach to get our numbers up. The first 50% of vaccines is relatively easy. The second half is going to be the real challenge. And while this bill was introduced during a very different time, I think the issues we're trying to address and give this committee an opportunity to provide oversight for still exist. There's also the funding component where we're directing the state to draw down 3.9 million in federal funds to maximize the amount of federal match for the costs associated with vaccine programs.
I don't see that. Is that figure in the bill?
It's included in the fiscal note.
Okay.
3.9 million in FY22,
Mm-hmm.
5.3 in FY23.
Okay. Any other comments from folks? What about narrowing the scope of the legislation, and if the section 2, I'm not sure how that would work. Is Maine Care reimbursing for COVID-19 vaccination administration? Do we know the answer to that, Molly? Are they paying for vaccinations, or is it coming from federal dollars? Or is it the federal dollars coming through Maine Care?
It's through FEMA.
For FEMA. And there really isn't a lot of room to negotiate on that one. That's right. Those are federal stipulations. So maybe section 2 doesn't apply. Section 3 is about reporting.
Sorry, Senator Claxton.
Go ahead.
I hope we could have a little more discussion on section 2.
Sure.
There, when folks are going for their vaccine, many providers are asking for their insurance cards. Sometimes, I think there are cases where a provider could get some additional funding based on what we've put in under section 2. I believe the providers could get some additional funding if we drew down this additional match. I did not come up with that figure of 3.9 million.
Mm-hmm.
Luke Lazur, working with the department, did. So I just want to make sure we're not leaving money on the table for providers or for us.
Mm-hmm.
And just didn't want that piece dismissed.
Okay.
Yeah.
Thank you. And as far as reporting, some of it stipulates reporting to us. The downside to that is that we're not in session year round to get reports. The other is that the reports are updated how often, Molly? Every day or 2 or 3?
The vaccine dashboard that we have is updated daily.
Daily. Okay.
And maybe days of, like Monday through Friday, but.
The other suggestion was made about including some information about disabled and our penetration into that community. But that's not something we've captured at all in our immunizations. That's not a category that people have asked about at the time of immunization. Is there discussion going, Molly, in the department about future data collection and any potential changes?
Yeah, so we have applied for a federal CDC equity grant that would, and part of our application that has not been approved or received yet, just to be clear, but we have asked for part of that funding to be used to assist us in improving our data. And so that would include having that conversation about how we capture disability data. I think there are some thoughts about how we could perhaps link data sets either with Health InfoNet or other repositories to get that information, but it's not information that we have currently very accessible. And I want to correct myself. There's FEMA reimbursement for vaccines, but currently we are also reimbursing 100% of the Medicare rate for providers who administer vaccine for main care members. But Director Probert notes that we're seeing very few providers actually bill us for that in addition to the FEMA reimbursement that they receive.
Okay. All right. Yeah, Senator Moore, you had your hand up.
Yes, I do, Senator Claxton. Thank you. I really still strongly feel that this bill is not necessary. So I'm going to make the motion of ought not to pass on LD 1077.
Representative Lemlin, you had your hand up.
Yes, I agree with Senator Moore. I was going to make the same motion, and I'll second her motion. But also, my district is not a very wealthy district, and I'm rural. And I do not have one constituent that has ever spoken to me saying that if they wanted the shot, that they were unable to get it in any way, shape, or form, that they couldn't afford it or it wasn't available to them. So I don't understand the need for the bill.
Okay, thank you. Representative Zager.
Thank you, Mr. Chair. I'm just wondering, I guess, and I'd like to understand a little bit more about what Senator Libby brought up about as I look at the fiscal note, it does look like all federal dollars that would be involved here. And so wondering if there, this might be a way to bring in more of those federal dollars to Maine because the effort, the good work that the CDC and providers and so forth all around the state are doing are not free. And so I'm just wondering if this might be that opportunity. I don't know the details of how, how to do that, but this seems to be an opportunity.
So I was going to go to Molly and see, is there any way we can maximize the dollars flow? I understand you've applied for grant dollars or federal dollars, but is there some way we can capture that 3.9 that's referenced?
Yeah, so I apologize. I was not, hadn't taken a dive into that fiscal note before this, but I'm looking at what we shared with OFPR, and it looks like that 3.9 is made up entirely of benefits payments through main care. So that would be fulfilling the main care reimbursement portion of this. My understanding from the bill text is that the outreach would be within existing resources, which is work that we're already doing, but I welcome clarification on that.
How much money did you just ask? What did you just talk about in terms of grant that you said was still pending, or?
I can find what we've requested for that grant, but I don't have it at my fingertips. So just give me 1 second.
Aaron, you had your hand up.
Luke is joining the work session now in case the committee has questions about how the work session or the preliminary fiscal impact statement was developed.
Okay. Senator Baldacci, do you want to introduce yourself while we wait for Luke to join us? Welcome.
Thank you, Mr. Chairman. I'm Joe Baldacci, Senate District 9. I represent the city of Bangor and the town of Hermit. And I'm happy to cast my votes on any bills I missed whenever you would like me to do so.
I'm not seeing Luke in the waiting room yet, but he's signing in. Is that what you said, Aaron? Okay.
He's logging in.
Logging in, yeah.
Now, right.
As we speak. Okay. So we're pausing here for our financial analyst. Yes, Darlene.
Would it be okay if I get Senator Baldacci's votes right now?
Sure.
Okay. LD 1601 was a divided report. The majority report is ought to pass as amended, and the others are ought not to pass. That is.
Which bill is that? What's the title of it?
To establish an advisory panel to study the implications of genome editing technology for the citizens of the state.
Okay, and it was ought to pass?
The majority is ought to pass, the minority
Yeah.
is ought not to pass. You're going with the
Okay, I'll vote
majority?
ought to pass.
Okay. And then 745, an act to strengthen Maine's public health by expanding access to certain health. Yeah, lost my, certain health programs and services. And that was ought to pass as amended, unanimous.
Okay, I'll vote ought to pass as amended.
Alrighty. NLD 582, an act to support fidelity and sustainability of assertive community treatment. And that is ought to pass as amended, unanimous.
Yes, I'll vote ought to pass as amended.
Okay, very good. That's
I
it.
just want to clarify that LD 1601 is ought to pass as amended. There's both going to be a fiscal note and there was a change to the membership.
Okay, I'll vote ought to pass as amended then.
Okay, so Luke, maybe you can help us understand the fiscal note of the 3.9 million, and we understand that's federal dollars. Where is that? What is that going to, as you understand it?
So as I understood it, that is strictly to pay for the administration of the vaccine itself. So this would not be additional funding for anything other than that. It would only be paid if the claim was sent in. So this is not a chance to necessarily get additional federal funding. All it does is increase the rate of that vaccine to the maximum level. And one of the CARES Act bills made within Medicaid, all vaccine administration 100% federal match. So that's why the entirety of that 3+ million is in federal dollars. It's because it's a 100% federal match for any COVID vaccine. And that 3 million is assuming that all the vaccines that get that are paid for main care members, the providers ask for that administration fee.
Okay. So we haven't asked for that monies yet. We're going to ask and settle up later, is your expectation?
Well, I would assume that the way it would really work is it would be based on if providers asked for that administration fee. Though I don't believe that the bill itself has any retroactivity to it.
Mm-hmm.
So at this point, it would be here going forward. So when the calculation was done, it was assuming, a ramp up time of how long it would take for all the vaccines to be administered.
Okay.
So that number would be drastically different at this point, though that doesn't, unlike with the general fund appropriation, that's not a huge issue for the committee because all this is an allocation. So a larger allocation doesn't really have any impact if there's no claim that needs to be paid.
Okay. Yes, Molly.
Thanks. And just back to the COVID equity grant, that application is for $32 million to US CDC. I just want to stress one more time for my own comfort that is an application. We've not been approved for that yet, but that's what we've requested.
And that was an application to go to?
Increasing equity in vaccine distribution.
Right. Who would be the recipient, the state or?
Maine CDC, yep.
Maine
and then
CDC. Yeah. That'd be nice. All right. And then do you want to speak at all to outreach to rural, historically underserved communities and what the department's doing?
Sure, and I apologize, I meant to lower my hand there. But in our testimony, we noted a number of the initiatives that we have undertaken to expand vaccine administration. We have the mobile clinic, which is mobile and has been in a number of rural communities. We work with the federally qualified health centers, including Maine Mobile Health, to make sure that they have access to vaccine and can provide those clinics. We've worked with an increasing number of primary care physicians to get vaccine to them, and have also been undertaking a lot of vaccine hesitancy and other access work with both public service announcements and media campaigns, and also a number of different options. I believe it's either yesterday or today that there was a ask Maine doctors about the COVID vaccine public event where folks can reach out and get that information, as well as working with ethnic community-based organizations and other communities to make sure that we're reaching them both in a way that communicates in a culturally appropriate way and have sites that are close to those communities for them to access vaccines.
Okay. Any other comments or questions? Anything we want to clarify before voting? Senator, yes, Representative Connor.
Thank you, Mr. Chair. I apologize for my color change in my light. I hope my hand doesn't get lost in that.
It does. Thank you for speaking up.
My question is from Molly. I was just reading an article the other day that said that the United States may have more vaccines than people that want them now. Is that the case in Maine yet? Do we know? Do we have more vaccines readily available in the state than we have people that are ready to receive them? Or is that data not available yet?
It's a complicated question. I think we've definitely seen the folks who are ready and able to sign up for vaccines have decreased slightly. We're seeing, some of the larger vaccination sites close in favor of smaller, more spread out vaccination sites. I think, and I believe Dr. Shah might have mentioned this to the committee, there are sort of two factors in hesitancy. There are folks who are skeptical or not comfortable or not going to, don't want the vaccine. And then there are folks who, if it was made easy for them, they would get the vaccine. It's really a convenience factor rather than a hesitance or skepticism. And so I think what we're tackling right now is is making the vaccine more convenient for folks who want it, but cannot or will not go out of their way for it. We don't have, more vaccine than we need right now, but we are needing to work harder as Senator Libby, mentioned the second half or the remaining portion. We are having to work harder to get those vaccines in arms. But it's not only hesitancy, it is some of this, equitable access piece which is why we have a focus on it.
Okay, so that was my next part of the question, was the plan that you had just mentioned that the department is working on. So the department is leaning more towards the conveniency part of that versus the hesitancy part of it.
Yeah, I think we're certainly tackling both, but there's a lot of work that we're doing on hesitancy, but I would say the lower hanging fruit is those folks who are not maybe hesitant, but but need it to be convenient. And so we're certainly working on both strategies, but
absolutely. Thank you. That's all I had, Mr. Chairman. Thank you. Thank you, Molly.
Any other comments or questions? Senator Libby, any other thoughts before we vote? Okay, very good. So the motion on the floor currently is ought not to pass. And seeing no further discussion, we'll ask Darlene to collect the vote.
Representative Zega.
Yes.
Representative Lemlin.
Yes.
Representative Stova.
Yes.
Senator Baldacci.
Yes.
Representative Perry.
Yes.
Representative Griffin.
Yes.
Representative Connor.
Yes.
Representative Craven.
Yes.
Representative Madigan, absent. Representative Javner, absent. Senator Moore.
Yes.
Representative Maya.
Yes.
Senator Claxton.
Yes.
11 in the affirmative, 0 in opposition, and 2 absent.
So Senator Libby, I think your bill was the nidus of at least a bunch of the questions that were directed to the CDC in general and to Dr. Shaw in particular. So thank you for that contribution. And thanks for being here. All right. Let's move on to 1570. Thank you for being here, Luke.
All right, 1570 is an act to protect drinking water for Maine residents. The bill has three major components. It establishes a free well water testing program. It requires landlords to test for arsenic, and it establishes a maximum contaminant level for arsenic in community water systems. So the first of these components is the free well water testing program. In that program, it requires, to that end, it requires the department to establish the program that would provide free well water testing for low-income residents of the state to be conducted by the Health and Environmental Testing Laboratory. The department is typically required to charge the average cost of testing and a fee for every test conducted, but the bill provides that under this free well water testing program, testing would be exempted from this requirement. The bill also requires the department to waive any fees incurred as a result of testing a private residential water supply upon a showing of indigency. Currently, it says that the department may waive the fees. This would change the statute to require them to waive the fees. And it authorizes the private well safe drinking water fund to be used to implement the free well water testing program. The sponsor proposed an amendment that would propose to clarify that the program would offer testing for the analytes recommended by and at the frequency recommended by the department from the well water being tested. The second piece of the bill is the landlord component. It would require landlords who use a private drinking well water to provide water to a tenant to periodically test the well water. It would require the landlords to promptly provide the test results to a tenant and to promptly notify any new tenant of the most recent results. The sponsor had some proposed amendments to this section that would expand the testing not just to from arsenic, but to all the specific contaminants or properties at the frequency recommended by the department. She also recommended extending the requirements to prospective tenants, not just current tenants. That's the notice requirement, that is. And adding a civil penalty of $250 per violation for landlords who do not comply with these requirements. The third component of the bill is about maximum contaminant levels. It would establish an interim level of arsenic at 5 parts per billion for community water systems. It requires the laboratory conducting the arsenic testing to report to the department anytime a test they run exceeds that level. And it requires the department to direct the community water system exceeding the level to implement treatment or other remedies to reduce that level, and is authorized to enforce that requirement. The department would then be directed to adopt rules to determine a final maximum contaminant level that would be acceptable for human consumption by December 31st, 2021. And in adopting those rules, the department would be required to consider recent research on the toxicity of arsenic and acceptable levels of arsenic consumption. Those rules would be routine technical rules. The department in its testimony raised some information and issues requesting the removal of an interim contaminant level, requesting additional time for rulemaking and the ability to consider the assessment of costs and treatment considerations and other impacts to stakeholders. And the department in its testimony also provides information to the committee relating major cost drivers of the legislation, which would include needing a general fund appropriation to the lab to supplement testing fees, increase staff, that the types of tests required by the legislation affects the cost, as does the frequency of the testing. I have a number of drafting questions related to each of those three components. And just to summarize, the free well water testing program applies to low-income populations. Because this affects eligibility for it also the program, it also would affect the cost of the program. I don't know if low income is sufficiently clear to define the universe of folks who would be eligible for this free well water testing program. In the testing requirement of landlords, it requires testing periodically. I think it requires notifying tenants promptly. Because the proposed civil penalty from the sponsors amendment would apply to both the testing and the disclosure requirements, I would recommend clarifying those terms because landlords would be subject to penalties for non-compliance. And so I don't know how you determine whether someone has periodically tested, what timeline that means, or promptly notified tenants of test results, what the timeline on disclosure would be. I wondered whether there was a difference between the term analytes and contaminants of properties. Both of those terms were used in relation to what would be tested for, both under the free well water drinking program and the landlord testing requirement. And I just don't know if there's a difference, but we should clarify the language. Testimony on this bill indicated that this landlord requirement testing was similar to the radon testing requirements for landlords, and that it mirrored that law, but as drafted, there are some differences between the current radon testing requirement for landlords, which I know we'll discuss later this afternoon, that there's actually an established testing frequency that's articulated in statute, which is every 10 years, that there's a calculable notification requirements for tenants, which is within 30 days of receiving test results. That similarly, the disclosure to the sponsor's proposed amendment, the requirements on radon apply to prospective tenants, and that the department is directed to prepare a standard disclosure statement form in relation to radon testing for landlords to provide to tenants, which is not a component of this bill. In terms of the maximum contaminant establishment, I'm unclear as drafted whether the final MCL adopted by the department would apply to just community water systems or other water systems. The interim standard only applies to community water systems, but the final standard is silent on who that standard would apply to. I also have a question about the rulemaking timeline and whether it's sufficient. The bill as drafted does not have an emergency preamble, so it would take effect 90 days after adjournment. So assuming you adjourn in early July, which I know we're all crossing our fingers about, the interim contaminant level will go into effect in early October. And then the department would have the final rulemaking done by the end of December. So you'd have about a 2 or 3 month period of an interim standard before the final standard goes into effect. You requested some information about New Hampshire's implementation of arsenic testing. I understand it's a recent law. I don't know how much information is available, but I did submit that request to the department and Sarah Woodbury at Defend Our Health. And the fiscal impact hasn't been determined yet. And I'm sorry, I feel like I just threw a lot of information your way, but I'm happy to go back to things as you get to those topics.
Very good, thank you. There's a lot of information there, and it's not part of our everyday conversations. Any response or questions to that prompted by the analysis? Yes, Representative Connor.
Thank you, Mr. Chair. I don't know who this question will be directed to, so I guess I'm throwing it up to the committee. I'm trying to, in reading through the bill, one hypothetical that comes up obviously is a lot of these wells are on, more rural units. And so in most real estate leases that I've seen of single family homes, the occupier is usually responsible for the general maintenance, all of the utilities, everything on that single family property. How would this bill play into that scenario if in the contract between the landlord and the tenant that the tenant takes care of everything on the home, are they now responsible for the testing of the well, or is that still going to fall back on the tenant? I guess my question is, does this supersede real estate contract law?
Now we're into the legal specifics.
I was looking at Senator Baldacci when I was saying that, just for the record.
I can't tell, but so Aaron, do you want to weigh in at all?
This isn't something I've looked into, but I mean, the statute as drafted puts the requirement on landlords. And so I think that would control the responsibilities between what landlords would have to do.
And help me again, Representative Connor. So the way you describe current tenant law, that it's the responsibility of the rentor to be taking care of the building and everything related to it?
Well, that's defined in the lease agreement with the landlord. So if, I rent a property to a tenant and they're responsible for everything and they agree to it and I agree to it, and that was the contract. That's my question. Will this supersede that contract that we previously have? That the tenant is responsible for all upkeep, for all maintenance, for all utilities, up to a certain cost. And if this testing is under that cost threshold, then it would fall to the tenant in that current scenario. So I'm just curious if this bill will supersede that and force all of those landlords to go back and adjust their leases. Again, I don't know the answer. I'm just curious.
Yes, Senator Baldacci, I'll call on you since you might have some expertise in the area.
Well, no, I would just say that it would I think as our analyst said, it would supersede the contractual obligations. But that still leaves open the door that two parties presumably couldn't negotiate how it's going to be paid or when it's going to be done or the rest of it, but it would supersede, existing contracts.
Can you make the argument, I don't want to spend too much more time on that, but can you make the argument that the water coming into a dwelling isn't the same thing as the dwelling itself? You're not charging for the use of the water. You're talking about the content of the water. I just throw that
I think
out.
you can make an argument for anything, and I'm sure there are attorneys who will.
Yeah, I still think it would supersede. I'm just trying to answer Representative Connor's question, even though I think I support the bill, but it would make it an affirmative obligation that does not currently exist.
Representative Craven?
Thank you. I just wonder how it would work if, there was 2 or 3 apartments and one well. How would the tenants be required to share the responsibility of the well?
Yeah. Representative Stover.
But isn't it under this bill, the landlord isn't required to treat the water, just test and disclose the result of the water test, correct?
Treat and
That's correct.
Treat
Just
and
test and
inform.
disclose, not
Test and inform.
Yes.
I'm sorry, test and inform, right. Okay. So let's take it in pieces and see if we can see where this takes us. One is the free well water testing for folks below a to be determined income level. Representative Lemlin, you had your hand up?
Yes, sir. Thank you. I just have one quick question. So the $250 fine imposed would be if they did not inform the tenants?
That's my understanding of the sponsor's amendment, but it would have applied to that entire section about both the requirement to test and the requirement to notify.
So the landlord would not be the landlord would not have to fix the problem under this bill. It would just have to inform the tenants. And if they don't inform the tenants, there would be a $250 fine. Is that correct, Darren?
Yes, that's correct, Representative.
Okay, thank you.
Representative Stover? Oh, that looks like an errant hand up. Okay. We were talking about free well water testing below to be determined income level. And we got information that the volume of that would be tough. To do until the HETL was expanded by the end of 2022. Is that was one of the emails we got, as I remember. So in some ways it's a capacity question. How do folks feel about the concept of helping folks who can't afford it, that term to be defined? How do people feel about that element of the bill? I'll hear from the committee first, and then we'll go to Sarah Woodbury. Any thoughts, any response to the idea? Yes, Representative Craven.
I think that it would be absolutely needed to have a fund where low-income people could access some kind of help to have their wells tested. We heard about the IQ issue with kids, and I think that besides being poisoned, that really is a big drawback. Thank you.
Okay. Any other comments from the committee? Sarah Woodbury, welcome.
Thank you. Sarah Woodbury, Director of Advocacy for Defend Our Health. I just wanted to respond to the earlier comment you made about capacity. That capacity presupposes that every single person is going to get their well water tested. And considering that only about 35% of low-income folks currently are getting their well water tested, I have a hard time believing that 100% of folks on well water are going to get their water tested. So I'm a little concerned about the capacity issue with the department because they've been trying for 10 years to get people to get their well water tested and have not met any of the goals that have been set in that program. So I don't anticipate that all of a sudden there is going to be an influx of people needing to get there. I mean, we would like to see the number increase, but it's not going to increase 100%.
So the numbers we saw in a email, I think it was yesterday's, yes, was that the percentage of wells tested in private homes had gone up about 10% in the 5 years between 2012 and 2017. I was curious about current numbers and if that trend has continued. So there's been some success there, but that also doesn't sort out wells where folks would be stretched to pay the additional dollars for the arsenic testing. Okay. So the other one was the maximum level of 5 as an interim. How do folks feel about that being an interim level until such time as there is departmental rulemaking? Representative Connor?
Thank you, Mr. Chair. I think I would tend to support the bill if there was some sort of definition of what low income is. I think we need to address that. You can't just say low income. I think we need to put a definition on that and put a threshold on it. And then the other part of it is I think I would feel more comfortable sticking with the national 10 parts per billion versus the 5. But again, those are just my opinions. I feel strongly that, we already have that standard. And I think we definitely need to define what low income is. So those are my two thoughts.
Okay, and I certainly agree on the low income as well as some other definitions that we need to clear up if there's civil penalties involved. We have to be real clear about that if we want to go down that road. The alternative is to not put any teeth behind it and not worry about the definitions as much as you would need to make it enforceable and have consequences. So does any Molly, you would have your department would have to help us sort out who was a candidate for this. Do you have measures that are routinely used in the department that would be helpful in determining low income? Are we talking about 135% of poverty level? Or are we talking about 200%? I'm open to any thoughts about that.
Sure, and thank you. And just a note there, Amy LaChance and Andrew Smith are in the attendee list and can help with some of the huddle and other technical questions on this. You know, this was a conversation we had on our SNCC bill, I think 2 years ago, about how to identify this population from the department's perspective. Who we can identify as folks who participate in one of our programs, and so we can say if you are a main care member or receive TANF benefits or receive SNAP benefits, you know, then those are the data sets that we have access to. We would still need to work on making sure that those could be shared in an appropriate way with CDC that didn't violate folks' privacy. But so the devil is in the details here. I think there are easy ways to define low income as a percent of federal poverty level or something like that. But then how do we either identify proactively or verify that somebody meets that definition is where it can become a challenge.
Are there people in the department who can speak to what the current barriers are for low income folks in terms of getting their wells testing beyond the financial one? The financial one we're talking about, but are there other barriers we should know about? So who might be able to speak to that as in response to the outreach efforts and how that's going?
Sure. I think Amy LaChance, who's our drinking water program manager, and Andy Smith, our state toxicologist, can probably speak to that. They might not have been prepared for that, but I'm hoping they are comfortable speaking off the cuff.
Welcome, Amy LaChance. And welcome, Dr. Smith. So the question's been asked, Amy LaChance, if you, the question I just asked was, are there barriers beyond financial that we should know about or be trying to consider if one of the goals of the bill is to help get testing done of more private wells for folks who don't have enough resources? Are there other barriers to getting those testing done for the 11,000 below 15,000 or the 360,000 households earned income below 25,000 based on 2017 dollars?
I can respond to that if you want, Senator.
Great.
So Dr. Andy Smith, state toxicologist, Maine CDC, DHHS. The barriers that come to mind is first and foremost is going to be awareness. So that's just getting them information so that they're aware of the importance of testing their water. We have initiatives I can talk about on that if you want. Then I think, and there's a little literature on this, it's whether or not they think they can do anything after they test. So if you test and get a high result, the question is, are you going to have the resources to treat that? The good news there is that there was money appropriated to Maine Housing to provide grants to low-income families to be able to install treatment systems. I believe from my emailing with them yesterday, they have about $180,000 left in that fund. They got 2 allotments. Initial 200,000, and then I think of 500,000 after that. So they've made good use of that money, but I think they now have about 180,000 left. So if someone tests high, and we would need to make them aware of it, there is options, and we already have a process of referring to them currently. So those are the 2 barriers that come to mind. We do a roughly annual mailing to all families in Maine with young children who are likely to live in a town with a high proportion of private well water use, with information to promote well water testing. So that's kind of our current outreach that we do. And we've augmented that in recent years with social media.
Okay. And do you have any sense of what the penetration is for income for houses with wells below a certain income? Is that a number that you can come up with, or is that
it's a number we can come up with. It's not a number we have a lot of confidence in, because if what we rely a lot, as I mentioned in the memo to you, is our BRFSS annual survey. So that's going out to something around 4,000 individuals in Maine. Only a small percentage of those are going to be low income in houses with wells that you're going to get that sort of information. So if we look at 2015, 16, and 17, we see a nice increasing trend in testing by low income, but the confidence limits are so huge around those estimates. I don't dare put a lot of confidence in them. So that's why I think what we can roughly say is currently right now, it's in that sort of mid 30% for that population. So it looks like it's heading in the right direction, but I don't have a lot of confidence in those estimates right now.
Okay.
Senator, if I could speak briefly to the Heddle capacity issue, because Ms. Woodbury may not be aware of this. The issue with Heddle is not so much about, I mean, the volume would stretch it. It's partly they are in an old building trying to run a 21st century ICP MS sophisticated equipment. And it's a struggle to run this brand new piece of equipment in an old dusty building. And so their preference, which was explained to me, is that you wait to make any big ask on Heddle for more testing until they move into the new building, which is scheduled in fall. So it's both a capacity issue, but capacity can be addressed with more people. It's also just a building infrastructure issue. That's the way it was explained to me.
Okay. All right. Ms. LaChance, did you want to contribute to any of this conversation so far?
I can speak some to the maximum contaminant level if you're ready to move to that topic. Okay. So we are concerned about both the process and the impact of this. Not concerned about taking a look at the MCL and determining whether it's appropriate or not, but we're concerned about the process. Normally, it's a very in-depth process to set a new maximum contaminant level with stakeholders and an inclusive, transparent process. But even more so concerned about the full impact of this and the timing. It's difficult to come up with exact numbers in terms of how many systems would be impacted by a move from 10 parts per billion to 5 parts per billion. And that's largely because most systems are sampling on either an annual or a triennial basis. And only when they go over the maximum contaminant level do they get put on quarterly monitoring. And only when they're on quarterly monitoring can they exceed the maximum contaminant level, because it's a running annual average. And I know that's all complicated, but it's not just a matter of looking at numbers that we have in place now and comparing them to a new maximum contaminant level and determining the impact. It would take time to determine the impact, and then it's definitely going to take time to comply with the new standard once we determine who would be out of compliance with that. And so we're concerned with an immediate impact of an interim standard going into play.
Okay. Senator Moore.
Yeah, thank you very much. That brings up another question I'm thinking about. With the current MCL at 10 parts per, or PPB, whatever it is, and I know that there were some people that actually got some of the grants from Maine Housing and put in the equipment that was needed to take care of that. If we lower that to 5, is that those that have the treatment systems already in place, are they going to have to replace them?
It's our understanding that there are some community water systems that have already installed treatment that would need to enhance or augment that treatment again in order to, if it were a 5 part per billion standard.
But,
So
but Amy, just if I may jump in here.
Please.
Please.
I'm gonna ask this in a way that Amy can be affirmative because I want to make sure I've got it right. But in response to Senator Moore's question, I think Senator Moore's question was specific to people that have taken advantage of the Maine Housing Grant Fund. So we're now talking about an individual homeowner. And Amy, aren't those systems usually, if you're in there treating, the odds are you're going to get well below 5? Isn't that usually when we think
Yes,
of private?
sorry, I misinterpreted that question. Yes, if you're talking about individual point of use systems for private homes, most likely those are going to take the majority of the arsenic out of the water. I agree with that.
And okay, the challenge here is that there's 3 significant portions of this bill, and trying to pin it down in terms of where we want to go. What if so I think the city water systems and the, what are they called, non-transitory water systems, the ones that are attached to schools and other facilities like that aren't truly public, they have to know that this 5 is coming. Is that generally understood in the industry, you think?
You're asking whether the 5 part per billion MCL is coming?
Yes.
Just based upon this potential legislation, I don't think that that's widely known at this time.
Yep. Okay, and there's 100 units. So there's 100 community water systems and non-transient, non-community water systems that have tested over the last 5 years in your note, Dr. Smith. So those are 100 plus that are candidates for upgrades, but most of them have already met the standard when you look at an averaged number.
Well, let me clarify that. I mean, if we're just talking about community water systems, we have about 38 community water systems that have exceeded the 5 part per billion standard at least once over the past 5 years. And those systems, but we can't say whether they would be exceeding the MCL or not, because like I said, some of these are only sampling every 3 years.
Yeah.
And they would then, to find that number between 5 and 10, we aren't currently telling those systems to go on quarterly and get a running annual average. And so it's only the ones that are over 10 right now, since that's the standard in place. And so we would have to determine which of these that are between the 5 and 10 actually exceed the maximum contaminant level, which would take a minimum of a year to get that. That's just how the standard is calculated in the regulations. So
To get to the determination.
to know who's out of compliance,
Right.
exactly.
Right.
Yeah.
Yep. And so would it work to build in a time for mitigation beyond appreciation that somebody exceeded the standard? So if we gave people a year to comply or something like that after being informed that they were outside, wouldn't that move the process along some?
It definitely some additional time after they knew that they were in violation of the standard, but that can be a significant amount of time to design a treatment system and to build a treatment system and put it into place can be years.
Okay.
That's why the federal government allowed for 5 years of an implementation period when the standard moved down to 10.
Yeah, and New Hampshire felt that they could do it in 18 months. So we're talking a shorter cycle than the feds. All right. Okay. This is complicated getting these three major pieces teased out. So it sounds like there's at least an appreciation for some additional time. Do we have any sense of what the heddle capacity is? Could it handle a 10% increase over the next year? So if we increased the amount of testing significantly, 10%, that's a significant number, then the lab could keep up with that. From your understanding, Dr. Smith?
Yes, I would think they would be able to keep up with that. I was more worried about a doubling.
Yeah.
So at some point you're going to have enough of an impact that they're frankly going to need more chemists just to run the instrument, because people do double duty. They're not always doing arsenic water tests or other water tests.
Yeah.
So they said if it gets big enough, they would need additional chemists. And then if it gets big enough, apparently what I've been told is they're struggling to keep their new instrument they just got running on a routine basis just because of all the dust and other stuff in the old building. So they're nervous about a major ask to all of a sudden become super efficient. That's what was relayed to me.
I
would think a 10% is not unreasonable. I think frankly we'd like to do better than that. And like I said, we do have efforts underway to try to promote well water testing, and we'll continue to do that. So,
okay, Representative, thank you for that. Representative Stover.
Thank you. I know we've talked about financing being available through Maine Housing for private wells, but on the community water systems, does anyone from the department know if there is money available through the American Rescue Plan or other funding that would help communities like mine to meet that standard? I'm not saying that they don't right now, but I'm saying it could be an unfunded mandate or financial burden. Is there money available to help communities?
There is money available through the state revolving fund money, and then there's promise of additional money potentially coming at us. It would prioritize systems that were over the federal standards, but we would still be able to prioritize systems over Maine standards as well. Again, it takes time. I mean, we absolutely would want to provide that money and would help systems comply. But the process of applying and getting the grant loan funds and then, like I said, designing and treating is concerned.
Thank you
that
very
same
much.
variable with the federal dollars and not knowing when they're coming in, what the guidelines are and the restrictions are is certainly part of that conversation.
Yes.
Yeah. Yeah. And if we're trying to make the case that certain installations, let's stick with the 100 plus of the more community water systems, shouldn't we be testing them more often to help verify whether they're in the 5 or 10 range to get them to qualify for the federal dollars?
We would have to try to determine the best way to implement this lower standard and determine whether, like I said, certain systems are testing only every 3 years at this time. We'd need to make a determination as to whether to put everybody on annual testing and then determine whether they triggered into the quarterly testing that would then exceed the MCL. Those types of things we were hoping to piece out during the rulemaking process.
Okay, and so the federal money, if it's dependent upon, if this is one of the triggers for getting federal money, we're not going to have information for 2 years if we change to 5 today.
Yes, I'd say that's a reasonable estimate of time. I mean, there may be some systems that are already on quarterly monitoring because they had exceeded the 10 before, and we may know some things about some systems, but yeah, it is going to take time.
So we're in the process of trying to move the needle a little bit towards public health and safety and trying to figure out how to do that responsibly without crippling communities with unexpected expenses. So could we go with 5 with mitigation required if there was adequate funding?
I think if you put an MCL of 5 in place, that triggers a lot of other compliance type activities in and of itself. I mean, traditionally in the Safe Drinking Water Act, the maximum contaminant level is the number that triggers activity. And I think to put that based on, whether money is available or not would set a bad precedent.
Okay. Representative Meyer.
Thank you, Mr. Chair. Could we do an interim 5 parts per billion? Much as we did with, I believe, PFAS.
Well, the difference between PFAS, there is no standard in place now, whereas currently there is a standard in place for arsenic, a federal standard and a state standard. And we would be happy to take a look at that standard, but we would like to do that as part of the traditional rulemaking process and determine whether to hear from everybody and determine the real true impact of that on the state.
Yes. Aaron?
Could I?
Oh, sure, Dr. Smith, then we'll go to Aaron.
Well, I just wanted to, Amy, I think what Representative Meyer had been asking perhaps, and Representative Meyer, you can correct me, but I think it was if you were to go with an interim standard, does the fact that it's an interim standard in any way change the requirements that would be triggered by a formal MCL? Am I getting close, Representative Meyer? Yeah. So I think that's kind of what she was trying to get at. Is there anything from a regulatory perspective that would be different with an interim standard as opposed to something that is called a state MCL in terms of what it would trigger and what, from all the other testing requirements, et cetera? Or is it's a standard that they've been told to comply with, and so it's going to trigger all the same things?
I think you could rewrite, you could write a more in-depth procedure that would be different than an MCL. It may be worth calling it something other than an MCL to avoid confusion, but I mean, you could, it's possible.
Well, that's an interesting idea. That's how they fixed the problem with too many kangaroos in Australia. They called them rabbits. So if we rename the issue, that might be helpful in some ways. Aaron, you had your hand up a minute ago.
I think I misunderstood Representative Meyer's question a little bit, but one of the other differences between the PFAS bill you've considered this year is the period of time that the interim standard would be in effect before the department would adopt a final rule on what that standard would be. And so I was just trying to pull up 129. It looks like a final rule on PFAS wouldn't be adopted before until June 1st, 2024, which is a couple of years out. And in this case, the interim standard would be in place for about 2 or 3 months.
Yes, Sarah Woodbury.
So just a thought about, because we obviously at Defend Our Health want the 5 parts per billion from a health protective standard, and also from the fact that the reason New Hampshire did it was going to end up saving the state about $4 billion in healthcare costs. Is maybe follow New Hampshire's lead and set it at 5 parts per billion, but give a time frame for the utility districts to meet that. I think New Hampshire's was 18 months, maybe 2 years here. So they know that it's coming and they don't have to switch over immediately, but they know they eventually have to get there.
And the part that I'm struggling with is that if we restart retesting all of these departments every 3 months, all of the more public water systems, the 100 plus, if we start testing them every 4 months, or every 3 months, it's going to take us a year to figure out if they exceed the interim MCL. Because the way the MCL is defined is the average of it's a rolling years average, right? Is that right, Amy?
Yeah, but if
that's
it's
correct.
going to take a year, then they still have another, they have a couple of years in there to figure it out.
We'd have to build that in. Yes.
Yeah.
Okay. Yeah. Okay. Yes, Dr. Smith.
I would caution Ms. Woodbury to be careful with the numbers from New Hampshire on the $4 billion. That is largely based on cardiovascular endpoints. It's based on value of life as opposed to healthcare cost. And more importantly, it's based on going from 10 part per billion to 3 part per billion, not 5 part per billion. And it's based on starting point of 5.483 part per billion in the water and going to 3. So if you're going from 5.483 to 5, it's probably going to be a lot less than what they have. So might be just good to be aware of the specifics within the document.
All right. So yes, thank you, Dr. Smith, for that. So there's still 3 parts. How do we help? So maybe I'll rephrase it. Do we need to help get more people with lower incomes help with testing their wells because we're already making some progress? Or do we need to set up a mechanism, either free testing or a fund to help pay for those? Let's focus on that for a minute. This is part of the reason I love omnibus bills. Let's focus on the part about lower income and water testing. We'll ask the department, what can we do to help promote more testing and get more testing done? Dr. Smith?
Well, Heddle continues to be a public health laboratory that is largely dependent on fees. So, if you start requiring them to do a lot more testing of wells for free, there's going to need to be a source for revenue to pay for the cost associated with doing those tests.
Right. Okay, so there needs to be a mitigation fund for the impact to the lab, and also one for people having to install treatment systems if they need it. Hopefully some of that will be federal dollars. Senator Baldacci?
I just wanted to ask, I'm just asking because I don't know, is it possible are there private firms that the lab can contract with to assist? Or does it all have to be done through the lab?
Yeah, no, I just had my arsenic level tested again a couple of months ago, and there's plenty of private labs that do it. So maybe the best way to go is to set up a reimbursement fund where a private lab, we'd have to figure out how to designate the people who would qualify for that lab to get reimbursed. They don't want to do them for free. Do we pay for all of them? Do we send a voucher to each household where there's a well and folks who qualify for main care living and tell them they can take this to the near water testing facility and have the facility build the fund? Those are the mechanics that would have to be set up out of rulemaking. We can't do that in committee.
Well, I think that, are you asking us which process, what we prefer as a committee members, or what would you like? What are you?
Right now, I'm just
what's
looking.
your query?
My query is, do we want to retain the portion of this bill that tries to address making water testing more accessible for folks with lower income?
Okay, so my answer would be yes.
Does anybody else want to respond yes or thumbs up or thumbs down to that in terms of whether that stays in the bill for further consideration? I'm seeing a couple of thumbs. Yeah, okay. So that gets us to the point. I saw a lot of thumbs. Thank you. That gets to the point. Next question is how best to do that. Representative Connor.
Thank you, Mr. Chair. Could that be worked through the frequency? If we change the frequency, I mean, the bill just says, what does it say? Periodically. If we changed, I see Erin shaking her head.
Sorry,
am I
that's the
wrong?
that's the landlord piece of it, Representative. Sorry to interrupt. I think we're just talking about the low income well water testing program at this point. Is that right?
Right, and that's what I'm getting at. So if we're looking at if we just dictate that I mean, this whole bill is for the landlords, is that not correct? We're talking about
No, some of this is for the rural person or
for
the urban
individuals
person who
that have their own, okay.
own
completely
wells, low income.
Okay.
Yeah.
So for the landlord portion, I think that it would be captured in the frequency, but then for the low income portion of it, you're right. I think we definitely need to figure that part of it out. So I apologize for my inaccuracy.
No, anything you can ask to help us clarify where we're going with this. Representative Meyer?
Thank you, Mr. Chair. The bill's sponsor has arrived
Oh.
and would like to be recognized.
Okay. Yes, Dr. Smith, did you want to contribute something else?
I just, as pointed out by others, we had some discussion around this a couple of years ago, and I think a couple of years ago we recognized that it would also be very expensive to make free well water tests available to all low-income families right away. So we tried to think about some possible ways of going at it in a more measured process over time. One of those was the idea of we would just try to do the sort of way that we currently make lead dust tests available to families for looking for lead hazards. And so we would do a targeted mailing to low-income families using some of the lists that Molly talked about, and assume we get about the same response rate, which is not particularly high. But that gave us something more in the ballpark, I think, of 50, 60,000 per year, and getting maybe 400 to 800 tests. If I remember that number, I'd have to go back and check those. But that was the idea of we'll do something. We just wanted to, then the discussion, and Representative Gramlich may remember this as well, then the discussion was we just wanted to make sure that if we were to do that, people would be satisfied with that measured gradual approach as opposed to something more aggressive. So there are ways to spread this out over a longer period of time, reduce barriers. We can control the amount by doing a targeted mailing of so many ones we go out until we reach our capacity and be moving along. So there are ways that we can tailor a program to a rough idea of a fiscal estimate that we think is more manageable, as long as it's clear that the expectation is that's what we're doing and not that we're trying to say reach all 11,000 households in the first year or the second year, et cetera. So I think that we can certainly have a dialogue about that.
Okay, very good. Welcome, Representative Gramlich. We've broken the bill. We've broken the bill down into parts, and we're trying.
Pardon me, Senator. I've been here for a really long time.
Oh, okay. All right.
I've been listening. I've been raising my hand, but nobody saw it. So thank you, Representative Meyer, for letting me in the room.
Okay.
I think I'm up to speed. I missed the very beginning of the work session, but I understand you're doing it in kind of chunks and sections. So thank you, Senator.
Yeah, in lieu of being staggering all over the landscape, we're trying to make it a little bit more focused. So I think there was a general sentiment based on a thumbs up to try and do something to help move the needle on well water testing for folks of lower income. Lower income needs to be defined, and the how would need to be defined. But from what Dr. Smith just said, it is possible to do this as a controlled involvement with wells around the state. We don't have to try and get all 11,000 or 32,000 at once. And therefore, we don't have to worry about capacity. If we're adding 400 to 800 wells a year in terms of testing, that's not going to overwhelm Heddle. Any thoughts?
I presume that was directed at me, Senator.
Yes, it was. I'm sorry. Yes.
Thank you.
I was looking right at you. How come you can't tell?
I don't know. It's Hollywood Squares on steroids here, so I can't really tell. Thank you. I'll take my hand down because I was going to respond. Yeah, I mean, I think for folks that are returning to this committee, this bill, as Mr. Smith alluded to, I introduced during the 129th, and it was worked in a very robust manner. Unfortunately, it didn't make it over the finish line due to COVID. This iteration that I presented to you all this time around does have the component in terms of tenants, so that tenants can be assured that their drinking water is also protected. But in terms of the definition for low income, I know there's a lot of talk last time around what that number might look like. And I was here when Ms. Bogart referenced using some criteria that the department currently uses to ascertain low income. I think the figure that has been tossed around at 15,000 annually is entirely too low. That ends up being about 50% less than what we're currently paying minimum wage in the state of Maine. So I think that if we brought it up to a figure that was more in line to at least even minimally what we're paying as a minimum wage in Maine, that puts us right around the neighborhood of 25,000 for an individual. So there's that piece. But again, if the department feels that we can get and capture individuals who are currently receiving services as identified through eligibility criteria like Maine Care, then I'm perfectly comfortable with that. The other piece that I heard some conversation about, and correct me if I misheard anybody that's been on, but there was some conversation about state lab testing and capacity. But my understanding if we contract in some way with private wells, it's a considerably lower figure. And so maybe I think I heard you, Senator Claston, talk about maybe setting up some sort of a fund where we could kind of help folks with getting that through private wells. So those are a couple of my initial thoughts. And there was a lot to unpack here, so thank you.
Yeah, well, thank you. Sorry, I've been kind of preoccupied and didn't see the hand up. So it sounds to me like we need some sort of fund, some sort of way to compensate the private labs if people go there, or the state lab, either way, for running those tests. So that's going to generate a fiscal note. And we'd have to figure out, according to what Dr. Smith said, that's maybe on the last mailings and somewhere under 1,000, maybe half of that. I understand I won't hold you to those numbers because it's recollection. That's not fair. But we can control the number of those by how many mailings we send out a year and how we do that and what the qualifications are. Those feel distinctly like work that should be done as part of the rulemaking. If we can convey to the department that our goal is to do whatever we can to help to move the needle on the number of private wells being tested, especially for those folks who might struggle to afford that. That makes it a much more general bill. Would that be acceptable, Representative Gramlich?
Thank you, Senator. And I think last time, and Dr. Smith, you may recall, or other members on the committee may recall, I think during the 129th, this bill had a fiscal note of somewhere in the neighborhood of around, or Aaron, you may remember, $50,000. And I think that was annually. So just for your frame of reference, that was a number that was discussed during the 129th. So certainly I'm receptive to that, Senator.
So 50,000 divided, yes, Dr. Smith.
I have to remember to take myself off mute. Yeah, the 50,000, again, Representative Gramlich, I think that's where we were trying to, again, peg a dollar value with an outreach effort. And we were, again, modeling this as if we were doing the lead dust testing initiative, which we also mail to families, and they say yes, and we send them a kit and they do the kit. So going into that is what response rate you're going to get if you send them a kit, what response rate. And you may remember we kept going back and forth. We just want to make sure you're okay with this approach because it's going to get you, this number under 1,000 of extra tests a year. And if we go to 25,000, which I completely understand the reason why you would want to pick that number, it just gets to be 36,000 households we're trying to reach instead of 11,000. And that's going to take a while at this rate. But maybe, in the fall, of 2022 when the lab moves, we can gear it up more. Or maybe if you find a way to have a voucher or some sort of coupon so it can extend commercial labs, then you can expand the capacity that way. It's just trying to keep in mind the level of effort with the level of funds we have. The need is great. We don't discount the need at all. So.
And just for the record, we're a policy committee. We don't worry about money. No, that's not true. Senator Baldacci.
Thank you, Mr. Chairman. I mean, I understand where the doctor is coming from. It's just that it begs the question about whether or not we need to add funding for staffing, and about whether we need to increase the staffing abilities so that these policy decisions can actually be implemented in a timely manner. Have you, I mean, it sounds like there's a need for greater staffing.
Well, we could set up a fund that would offset the cost to the lab of staffing and running the, I don't think we need to get into that. We want to leave the flexibility we can to the department. If we give you $1 million, can you do as much testing and hire the people you need to do to get the testing done when you get in your new facility?
Okay.
Maybe if we set
Fair
up
enough.
a big enough fund and leave them the discretion about how to use it, we can move things along that way. That's, yes. Representative Gramlich.
Thank you, Senator. I appreciate your referencing that all of us who are on committees of jurisdiction or policy committees and our good friends on the appropriations committee can kind of sort through some of these priorities with funding. But albeit that, I will say, I understand that there's a good chunk of change coming from the governor's office in terms of money for drinking water. And it's somewhere in the neighborhood of 25 million. So I'm curious if that might be an opportunity to help offset some of these costs. I just put that out there for folks to chew on.
And we have talked about whether AFA should have a ARPA table for all of the projects that people want to tap federal dollars for. I think it's going to be huge. Dr. Smith, did you have another point?
Oh, I put it up and put it down, but I think the point is just the importance of keeping two things in mind. One is getting people to test and the cost to test. But for these low-income families, it's also going to be helping them to get treatment systems. And so we have money now with Maine Housing, but as I mentioned, that number I'm told is around 180,000. So, if a treatment system's $1,000 roughly a pop, can be vary depending on other issues. It could be considerably higher than that. That'll just give you a sense of what we can handle now. And so then the question will be how much more it will be depending on what you put in for treatment systems. If people use the sort of systems that are like a reverse osmosis or a absorbent media, that's kind of the price range.
Okay. So the $1,000 figure helps. So that's 180 wells. That's 360 people. But we can also we can try to supplement that amount, put more money in that fund. That's the logical place for it to sit for testing and mitigation. It doesn't help with the lab expenses. So that would be a separate fund. All right. So we still don't have a definition of low resource, but for the sake of argument, we can pick any number actually. And then we'd have to anticipate how we would accomplish that over X number of years. Yes, Aaron?
Right. So I think that last year when the committee was.
Aaron, you had your hand up. Where'd you go? No, now you're frozen.
Oh, no.
We're
Can you
not
hear me?
hearing you, and your video is frozen, Aaron. I told you we had some technical requirements to meet in terms of problems. This helps us.
Does that work? Can you hear me now?
That's better now, yes.
Okay, sorry about that. I think when the committee was considering 1943 last year, they had received information from Dr. Smith as he was describing about what could be accomplished within a certain amount of an appropriation for outreach for low-income well water testing. And I think so the committee at that time did not define the term low income either, but decided on what that appropriation amount should be based on information it received of what they could do with those dollars. And so Representative Gramlich was right. It did turn out to be a little over $50,000. And for those comprehensive well water tests.
Okay, so we could appropriate some money and then let the department do whatever it could to get low-income folks testing their water with a combination of outreach and offset for the expense of the lab testing. We could also appropriate some dollars to supplement the main housing fund for this work. Would that accomplish that piece of the puzzle in terms of addressing low-income testing? To this, can people live with that? Representative Gramlich?
Yes, thank you, Senator. I certainly can. And again, I want to just keep on our radar the definition that Ms. Bogart identified in terms of being able to delineate low income. I mean, there's already some eligibility criteria utilized by the Department of Health and Human Services in place. So it wouldn't be like anybody's recreating the wheel on this. And it sit in line with what the department's currently doing.
But the advantage to us in the committee is that we don't have to be too prescriptive. We can leave that to rulemaking. That's where I was going with it.
Indeed. Yes. Thank you.
Okay. All right. That gets us 1/3 of the way through the bill. And I need a break. Half hour for lunch. What do people think? I see
Right.
one thumb up and some head nodding. All
So
right,
you
let's
have a
say,
public hearing though, Senator. You have a public hearing at 2 that I understand you're starting at 2. So I think that
That's not
was
gonna
my
happen.
understanding.
that's not going to happen.
Just as you consider how to fit in your work for the rest of the afternoon.
So, and I'm working off an old schedule. What are the public hearing numbers? What are the-
1695. It's about GA.
Yeah. All right. So we would have to reconvene in about 15 minutes. We'll do a little bit more work on 1570. That's the way it would lay out. And at 2 o'clock, we'd have the public hearing. And then come back to a work session, which doesn't feel very satisfactory. But I'm puzzled as to why we need to go ahead with the 2 o'clock work session, public hearing, if we're having a delay in our work session.
That was what was communicated to me. I could have misunderstood. Perhaps Representative Meyer has more information.
My discussion with the bill's sponsor was that it was scheduled for 2.
Okay.
But if our morning agenda is not completed, that the public hearing would come upon conclusion of our morning work.
And if, depends upon how many people are interested and it's 1695, not, I wrote down 1695. There's only 2 people right now who are scheduled to testify, so we could do that and then come back into work session. All right, so we'll reconvene at 1:45, give us almost a 30-minute break. And then we'll do some more work on 1570, quickly hear take care of the public hearing, and come back into work session. Okay, see everybody at 1:45.
I just sent you to the list of the 4 people that are going to be testifying on 1695
Okay, thank
as an
you.
email.
Thank you.
You're welcome. Probably
And-
doesn't look like what you're used to, but
Senator Claxton,
Yes.
can we just let those who are intending to join us for that public hearing know that I have communicated with the bill's sponsor, and she understands and is in full agreement with the public hearing being upon the conclusion of our work sessions today.
So welcome back, everybody. I hope you enjoyed a leisurely lunch, as we've been doing so much of in the HHS recently. So we got as far, I think, as a workable approach on low-income well water testing. I'd like to jump to the maximum level. Is there sentiment in the committee for promulgating a level of 5 as an interim level until the department completes its rulemaking? Is there any support for that or not? Okay. So there is some support for that. How about support for the private well water testing as relates to the landlord and tenant relationship? Is there any sentiment for pursuing that? I'm not seeing a lot of enthusiasm for that particular piece.
I don't understand the question exactly.
The question is, do we want to deal, what's the sentiment around the second part of this bill, which assigns responsibility to the landlord to allow landlord arsenic testing. Requires a landlord to periodically test the drinking water well, and inform their tenants. That's section 7 of the bill.
I'm in favor of doing that. If there's more than one tenant, it's really hard to figure that out.
Okay. Sarah Woodbury, did you have something to contribute?
Yeah, just very quickly on that. I know there was some concern around the periodically in that language. So I guess my suggestion would be to make sure that the sponsor's amendment that says, puts in the language that prospective tenants are notified, and then you could change that periodically to every 5 years, which I think falls within the CDC guidelines, I think are every 3 to 5 years. So as long as prospective tenants are notified, then the landlord could do it every 5 years to check, and that would take care of the periodically issue that was of some concern, and have them notify within 10 days. And which would also take care of the other kind of amorphous, people weren't sure what that meant language would
So
be our suggestion. So
are landlords currently required to test? No. So that's the other part of this stipulation, other part of this bill, that will require landlords to test and then inform tenants. Okay, within a certain
Right.
time frame. And the frequency could be whatever we decided is, but 5 years would probably be more landlord friendly than 3 or every year or 2. Okay. All right. So maximum interim maximum level of 5. We don't want to call it an MCL because that involves calculation. Is there any sentiment about that? Is your hand still up, Sarah Woodbury? Okay. So is there any sentiment about, any thoughts about that? Amy LaChance.
Yeah, I'm just concerned about the implementation of that. By putting that in effect immediately systems are going to need to start making decisions about how they're going to deal with potential exceedances of that, and they will need to make it based on the interim standard. It also, we just don't have a sense of the impact of this on the systems at this time. So just wanted to voice my concern about an immediate impact MCL.
So a couple thoughts. If we set up an interim MCL, I don't want to use that term, an interim maximum level of 5, and gave people 5 years to address that would, and give the department some time to do their rulemaking. That would instill some flexibility. It would give the water systems notice that this was the likely place we're going to land eventually, and give them some time to remediate.
That is very similar to what EPA did when they implemented the move from 50 parts per billion down to 10 parts per billion. They implemented the regulation, but then gave 5 years for the actual enforcement of the regulation. So that.
Any response to that idea? Representative Stover, you had your hand up.
Yeah, I just wanted to, is it unrealistic to include the part of any available resources, since we believe that there will be resources for water? It's just the unfunded mandate piece of this. I know for some districts it's going to be a challenge.
Yes, I think we'll need an appropriation, a fund to support that, and I can't speak to where that money is going to come from. But yes, there might be federal money, but since a lot of systems haven't demonstrated they got a problem, they may have trouble qualifying, at least under the arsenic level issue. There may be multiple other places they could qualify.
Good point. Thank you.
Okay, yes, Representative Gramlich.
Thank you, Senator. I just was curious about that 5-year threshold. Was that 5 years to implement the 5 parts per billion, or was that 5 years to respond or enforcement? Because it just feels like a long time to me. And I'm wondering if we might consider looking at, maybe 2 or 3 years for folks to be in compliance and for folks to be concerned with enforcement. I'm just curious where that 5-year threshold came from.
The 5-year came from the conversation we had earlier about the federal changes. It could be 18 months like New Hampshire did. I'm not wedded to either one of those, and I haven't heard any sentiment. I'm just trying to respect the expertise that Amy brings and give the people a chance to do. It's going to take them a while to figure out, as the point I make again. It's going to take them at least a year to figure out. If they go to every quarter testing, which isn't the norm now, then it's going to take a year to figure out whether they exceed the 5 MCL. So that's already built in. So after that, is it 5 years from now? Is it 5 years from then? Is it 2 years from then? I'm just trying to float possibilities. Representative Perry?
Yeah, I think my concern, especially with the 5, is that we're going to have community water systems that are going to need the time to be able to get the money and work the mitigation. And that does take time. And I don't think it's unreasonable to put a 5-year on that.
Representative Zager?
Thank you, Mr. Chair. I'm more comfortable with something considerably less than 5 years. I thought it was interesting that the Maine Municipal Association testified in favor and suggested something along these lines. So I mean, there's known harms. Arsenic is a poison. And so, we all want good things for ourselves and our loved ones. And so like delaying simply means longer exposure to more people of a poison. And so I would be more in favor of something. I recognize the the practical considerations and so forth. So I'd be more in favor of something along the lines of 2 or 3 years.
Amy LaChance?
Yeah, I was just going to say that I think that during that 5 years, there would be a lot of activity. There would need to be, like was pointed out, there would need to be the funding piece that would need to be moved forward. First, there'd need to be the compliance piece. Then they would need to figure out the funding. Then they would need to do the design and the implementation. And it wouldn't be, sitting around and waiting for the 5 years to start working on it. It would be with the knowledge that that was going to be the standard, and it would be a movement towards that during that time frame. And I think that may be a reasonable, realistic time frame.
So that would put it July 26 to become compliant, roughly. Okay. All right. Any other thoughts about that? We've heard a couple of people wanting to do 2 or 3. The 5 was thrown out from prior Fed experience. We have the 2 from New Hampshire. Anybody want to split the difference, make it 2.5 years and make it by January of 25?
I would second that motion for January 2025.
This is the trouble with doing things by committee. Yeah. Yes, Representative Meyer, and then we'll go to Mr. Chance.
Thank you, Mr. Chair. I'm not sure it's a motion, but I would agree with January 25.
So that's a little less than 4 years from now. Okay. I see you took your hand down. That means that okay, you're all set then. All right. Thank you, Amy. All right. So for that piece related to city, and I'll have to look up the term, non-transient, non-community water systems, that 100 plus of those would have between now and January 25 to figure out whether they needed to mitigate and then mitigate and then design, fund, and build these services into their water systems. That's what the proposal is related to that section 3, or the third part of this bill. I'll put it that way. Yes, Aaron?
Sorry, I'm looking for a little clarification. So are you determining that 5 parts per billion is the final MCL and delaying implementation until 2025? Or is this an interim level, and then at some point after 2025, the department is going to set a final level? I'm just not clear what the process here is and who this applies to.
Yeah, my understanding is that, for lack of a better term, we could consider 5 as an interim alarm level. Okay, and that starting whenever this goes into effect, or probably the day after it's passed, the department can work on rulemaking to adopt final MCL. And we haven't specified how long that's to take. But the idea is that this gives the community's warning that we're headed to 5, and you can start planning on that, and you'd have to have it in place by January of 25. But it gives the department time to do its rulemaking to come up with a final MCL. It could be 5.5, it could be 3.5, it could be whatever.
Oh, okay. I guess I'll keep listening. I'm just a little, I just don't understand how the 2 pieces work together. I'm really sorry. I'm not trying
That's
to.
okay. I'm hoping we can use the 5 as a heads up level to the community water systems. That's coming, and you're going to have, unless something changes from the department, until January of 25 to become compliant with that level. So it's a fixed level, but I don't know how it fits in statute.
So Okay, so would the level be repealed when
Yes.
whenever the DHHS does their final
Until-
rulemaking?
Until such time as the HHS final rulemaking is approved or is done, completed.
Okay, and
It's an interim action level.
but with no enforcement until 4 years from now.
Yes,
And it applies to both community water systems and non-transient, non-community water systems?
you had to look it up too, yes.
Didn't look it up today.
Okay. I have to keep going to my notes. The non-transient, right. Yes, it would apply to both.
Okay, in that case, this triggers a mandate, just like the PFAS did, because you're including schools that have their own private well water.
Right. And we're talking about requesting funding for a mitigation resource for the towns impacted. Representative Zager?
Thank you, Mr. Chair. As drafted, then would that, I'm sorry, as we're discussing it now, would that mean that the final determination would not be able to be more than 5, or is it leaving open the possibility that it would be, I think, as you said, 5.5?
So do we want to put a top end on it? Yes, Ms. Woodbury. Oh, you're muted.
Sorry. May I suggest doing something similar to what you did in the PFAS bill, recognizing that you're setting an initial MCL for PFAS where there already is one for arsenic, but there is language in the PFAS MCL bill that says the department can do an interim that can set the standard, but it cannot be above something. So if you're gonna make the water districts do all of this work to get it down to 5, and then all of a sudden have the department say it can be 6, that doesn't make a lot of sense. So I would suggest adding language that's saying the department can do the rulemaking, set it lower, but they can't set it above 5.
Okay. That answer your question, Representative Zager?
Yes, thank you, sir. I appreciate it.
Address your concern, yeah. Molly?
Thanks. I do, for if you're looking at January 2025, that is plenty of time to promulgate rules. So I just want to note that it might make the interim standard sort of irrelevant, which I think would be, fine if we said, by January 2025, the department shall promulgate rules to establish a state MCL. That would be fine. But I think what Aaron might have been trying to get at earlier is that if there's a substantive amount of time before anything goes into effect with enforcement, then you may not need that interim. We may just, need a reasonable deadline for a final MCL.
Not higher than.
If that's your policy decision.
Yeah, right. So that would address Representative Zager's concern. So would that be easier to write, Aaron, then that way that this would be a by January 2025, the community water resources would have to be compliant with a level of 5 or lower as determined by the department.
Okay. So this is what I had understood you were talking about. So you would have an interim level in effect until January 1, 2025 for both community water systems and non-transient, non-community water systems. And that after 2025, that's when those water systems would have a responsibility to mitigate and treat the levels of arsenic to meet that interim standard. Then in the meantime, the department would be engaging in rulemaking without any kind of time limit on when a final rule would have to be implemented or adopted to find a final MCL. When the final MCL comes out, the interim standard of 5 gets repealed, but the department standard can't exceed 5 parts per billion. And that you are going to be identifying some kind of funding to fund schools who are subject to this at 90%.
So yes, the latter portion, no to the first portion. At this point, the conversation is about striking the interim 5 level and just saying that as of January 2025, that these systems need to be able to meet the department standards, which is going to be set at 5 or lower, and not setting up an interim level. That gives them 4 years notice, basically, that they're going to 5. And it leaves the department some time to do the rulemaking.
Thank you.
And we need some time to build up that fund. That may not happen right away, but if there's no mitigation efforts going on for at least a year, then the fund doesn't have to be all that big in this biennium. Okay. All right. Dr. Smith. You're still muted, sir. Now you're muted. And I can see it. Now you're still.
There we go. I found it. I just have
There you go. All right.
3 mute buttons.
You got too many
if that
mute
wasn't,
buttons.
yeah. We're texting madly to try to see if we can all get on the same page here, but so I'll take a risk. I think what Molly was trying to get at, Senator Claxton, was that if you are willing to give until January, whatever it was in 2025, to implement a standard, there's no need for an interim. You can just say the MCL is 5. It becomes enforceable and effective at this time, and that's giving people the time to get there, and you've just sent it right. So that just makes it, I think, much simpler and easier. We don't get the rulemaking process, but again, I think, and hopefully Amy will correct me if I'm wrong here, our major concern is not the number. It's getting to the number and making sure there's enough time for systems to do the work. They have to find out if they're going to have to do this, and if they are, where do they get the money, do the engineering, and make that happen.
So based on that, I think we are on the same page. Representative Gramlich, did you have a response to that?
No, that sounds fine. Thank you, Dr. Smith. I think that you just kind of articulated what everybody was saying in what I thought was a pretty clear manner, so that you wouldn't need the interim. It would just be, here's the level for the 5. It stays at 5. It becomes enforceable January 2025, as Representative Meyer identified.
At 5 or lower, whatever the department determines, right?
Correct.
Okay. All right, so that sounds like a place to complete that conversation. And then it gets to the next portion is section 7 of the bill, which is the landlord arsenic testing. And it talks about notifying residents, and we've talked about 10 or 30 days. We've talked about this, and then we've talked early on in the conversation, Representative Connor raised the concern about new contracts. So could we make that with renewals or with new contracts and put it into the future? For property changes or renewal of contracts. Maybe you can help me out. I'm sorry, Representative Connor. Are most of those annual renewable if you're renting a house, for instance?
Correct, Senator. I mean, most of them are going to be on a yearly basis.
Yeah. So if we said that the lease or the lease and rental arrangement would have to be include this element when it's renewed, would that give the landlord some wiggle room?
I mean, I think it would. I think, it's a tough one, but if you're talking about the notification process, is that what you're talking about, Senator? Just
I'm talking
when
about
to
the
notify
test.
them?
I'm talking about the testing process and who owns that.
So, I mean, I think the testing process, didn't we talk about it being 2 or 3 years? Is that what we were referring to? Every 3 to 5 years that the landlord has to test the property?
And I'm talking about the initial testing, assuming the property hasn't been tested.
Mm-hmm.
What do we do to get the landlord to do the testing? What's the next, what's the trigger for them to do that? Because right now it's not required.
Right. So, I mean, I think that's just going to be whenever this committee, sets that date, whether
Okay.
it be 30 days from enactment or 1 year from enactment, you have to get it tested.
Okay. And okay. And then notification within, how do we make sure that the tenant has been notified? Are you going to send a letter to them and that's enough? Do we need a certified registered copy? That gets to be a little bit dicier. Has this been done somewhere else that we know of?
The radon statute, the radon testing requirement is an existing current requirement that I'm aware of that has tenant notification requirements. There might be other ones about bed bugs or something, but I'm not as familiar with that.
And that's for landlords.
Yes.
Okay. So same category, same different pollutant, different poison. Okay. Representative Craven?
Yeah, can the lab send out a notice as required by the landlord or requested by the landlord?
That puts significant work on the department. Is that what you mean? Or and that assumes that the lab goes to the state lab and not to some local private lab. If I'm the landowner, I'm going to go someplace most convenient. I'm maybe not going to mail it in, but might hand deliver it to A&L Labs on Center Street. Just saying. Representative Gramlich?
Thank you, Senator. You might want to go to the least expensive shop in town, presumably. But I think, and Aaron can correct me, I think there might already be something that is required in this, germane to this conversation in terms of lead and notification of lead. So I don't know if that would be something that you could look at as well. I mean, when I've rented for years in the city of Portland, and every single time I signed a lease, I had to be informed the status of whether or not there was lead paint and how long it's been there. So I don't know if that's something that the committee might entertain.
Yeah, I've been spending more time looking at radon this session than lead, so I am not as familiar, but maybe Dr. Smith has information about that, the lead program in that respect.
Dr. Smith, do you have something to chip in here?
I do not at the moment. I'd have to go look it up myself, but I agree with Aaron. I think the radon is a better model, much more directly applicable.
Okay. So then the question comes, do we want to lift language from the radon legislation and put it in to this bill as a way to get the testing done? And if we do, is that something we can do and then see at language review? Is that adequate, or do we need to table and see what it looks like when Aaron comes back to us?
Are you, I mean, I can share the statute with you on radon right now, if that's helpful.
Okay, that would be helpful. Senator Moore?
I was just going to say, I am so confused with this bill and all the different paths that we've taken. I would make the motion to table it so that we can at least get a good, clean look at what the bill might even look like. I'm just so confused at this point.
So do you want to consider that a motion?
Yes, Senator Claxton, I make a motion to table this for final review of what this bill's going to look like before you take a vote.
Is there a second? I didn't hear a second. Okay, I'm not hearing you, Representative Connor, but I saw the hand wave. We're good. So that's seconded by Representative Connor. So all those who are who wish to table this motion until we see a more cleaned up copy of where we're going, including importing the radon language, January 25th date without interim level. And I think that's the major pieces. All those in favor of tabling, please show your hand. So that's unanimous of those present. So that is tabled. Aaron, do you feel like you have enough direction to try and redraft this thing?
I mean, there are some significant gaps of policies that you hadn't reached. It didn't seem you had reached consensus on. So I can't, and I don't make up the policy. So
No, I don't understand that part.
I'm not really sure I understand that we reached some consensus perhaps around the contaminant level. Beyond that, I'm entirely unclear about where we are.
Okay. So let me see if I can summarize what I understand, and I will depend on the committee to correct me. So as you said, we've eliminated any consideration in the bill of an interim level, contaminant level. Related to that, we put in a January of 25 compliance date, which gives the department time to work on its rules. Okay. As far as the low income testing, there was, we decided not to define low income, but leave that to the department to work its magic with getting to those wells that are at risk, the low income wells that haven't been tested. Getting them some money to provide either finances or personnel to get that work done. So what am I, and then on, what am I leaving out on that part, anybody? As far as low income testing? I'm not hearing anything. So
What was the piece about working with staff to get work done on the well water testing? I missed.
that we would that we need to come up with an appropriation that would allow the department to continue its efforts to expand low income well water testing, and leave it to them to figure out how that's done. So we need a number for that appropriation. And the one number was talked about last time was 500,000, but that was for outreach. I'm sorry, 50,000. That was for outreach. So if we made it 100,000, Dr. Smith, would that be a good place to start for the department and its outreach effort?
Yes, we'll scale to whatever amount is there with a targeted outreach campaign of probably, again, direct mail to low-income families living in towns with a lot of private well water reliance, and maybe even additionally based on occurrence of high rates of arsenic.
And if you got the extra money, then that would allow you to get to the maybe 1,000 if we're lucky in a given year.
Yeah. And we would, in response to Representative Gramlich, we would, look to some of the department standards sort of measures for what low income is and draw a list from those.
But the department can do all its own internal rulemaking about that. We're just trying to support your ongoing efforts.
Yeah, and I'm not even sure any rulemaking is used. We'll scale it depending on the funds you make available. The directive to us is to do the targeted mail campaign.
Is that enough detail for that particular portion, Aaron?
Yeah, we'll see.
Okay. And then the remaining part had to do with landlords and well water testing. And it sounds like it's the responsibility of the landlord to be testing the water. What's it say here? How often does it say? Periodically. So based on the chemistry of arsenic, should we be retesting rental properties every 3 or 5 years? Dr. Smith.
We generally recommend 3 or 5 years. I think for the purposes of this, 5 years would be fine.
That would get a bunch of rental properties to get started on a 5-year cycle.
That's after they test. So I think to Representative Connor's point, you'll want to set a date for when they have to get that first test done.
Yeah.
Similar to what they did with radon.
Right. And okay. All right. So we could do that within is a year enough heads up for a landlord to get the $50, $30 test done?
It's a $140 test.
I was referring just to the arsenic portion that was described in your letter. Yeah, I'm focused on arsenic right now. Actually, I'm looking for some, but anyway, so 100 worst case scenario is 145 if you do it at the state lab, and not all that different if you do it locally, as I did a couple of months ago. All right. So we could build in a to be done within a year. Representative Gramlich, how is this sounding so far?
I feel bad for your analyst. I just wanted to make sure, Aaron and the rest of the committee, that we didn't lose sight that the amendment does include prospective tenants. Thank you.
Okay.
I just feel like we're working the bill, but you're telling me to go decide what the bill should be. So I'm having a hard time right now.
Yeah.
But the sponsor also had a proposed amendment about making it a comprehensive test, not just about arsenic. So I'm not
That's
clear.
145.
Okay.
So I think at this point you mark up with what you have for information from us that you're comfortable with. You try and import the radon reporting process. And we look at it when we can get it off the table. Because we're sort of working the bill right now. Because there's so much still up in the air. That's what you're saying, right, Aaron?
Yeah, I just want to be really clear that whatever I bring back is not a proposal from me. It is not a suggested way to do it, and that these are policy decisions that are up to you all.
If you want to put drafted for sponsor on it, that'd be good.
I'm drafting for the committee at the moment, not the sponsor.
Right. Yeah. Okay. Because it's our bill still. Okay. Not very clean, but we've made some progress on a very complicated bill. All right. So I know what we said before we left, and I appreciate the update from Representative Meyer, but let's just move on to LD 819. And the sponsor has an amendment.
Mr. Chairman, I think that I provide that amendment to the committee. I don't know, Aaron, I'm assuming you have it. If we could screen share it.
Yep, just give me a minute. I'll switch
Sure, take
gears.
your time.
Sorry, I'm sorry. I'm trying to pull it up now.
No, you're doing great.
I've got it now. You all see Senator Baldacci's amendment?
We can. And it's big. Thank you.
Well, as I get older, I need larger font size. So I'm sure there are others that are sympathetic to that issue. So what I did is I obviously have done some major reworking. I spoke with representatives of the department, Jay Hyland, the head of the radiation program, and I also reviewed a report that I sent all of you that Harvard had done on radon policy nationally. And I've also communicated with the Maine Realtors Association. So I think Andy Cashman should have emailed the committee that he has withdrawn his objections based on the amendments I provided. I would prefer mandatory requirements, but I prefer ultimately at a minimum that we do something that's constructive and moves the conversation forward and helps test for more homes for radon and helps in terms of the public health issue. So I crafted this basically after what I had read about what the state of Minnesota had been doing with home builders in terms of having a voluntary recognition and rewards, kind of creating a program of incentives for people and set out standards for landlords and home builders, because we had a discussion previously about the Maine Housing Code, and the Maine Housing Code, while it is mandatory and in municipalities of more than 4,000 people, it is not mandatory in municipalities of less than 4,000 people, which is probably over 150 municipalities in the state of Maine. So it's not an insignificant slice of our population, as well as to also bring in, because I know we were discussing, and I talked somewhat with Representative Kessler, but also to include a voluntary program in terms of home sales. I think that, and what I had proposed was that we provide some level, that we pay for the testing there, and that we pay some measure of the mitigation expenses if mitigation is required. There is a radon relief fund that small amounts are used each year for grants and stuff, but I think it has like 200,000 or 300,000 in it. But irrespective of that, I don't anticipate it will need this bill will need a fiscal note, but I don't anticipate a significant one because I'm giving the department a year to develop these voluntary programs with stakeholders. That's at the beginning. Thank you, Aaron. I appreciate it. About voluntary program with stakeholders in terms of how to set up the rewards and the incentives, the recognition. I think basically this is a way, I don't know if it's a middle ground or whatever, but it's trying to create an invitation to collaborate with builders, realtors, landlords, and getting people to sign on to the currently accepted standards and to have some level of recognition as well as incentive to take part in this. So future legislatures can determine whether or not this was helpful or not, and deciding whether or not in the future at some point there should be mandatory standards. But I'm hopeful that the voluntary approach with incentives and cooperation can get us part of the way down the field. And even though I didn't reference the specific, I did with the landlord section say about the $600, but I mean, the same kind of incentives, I'm presuming these stakeholders could provide to any participant, regardless of whether they're a landlord or a realtor, a home seller, or a builder. So I'm hopeful, I'm happy to answer any questions. I'm hopeful that we can at least make this step forward and do more than we're doing now, because really the state, in terms of from a legal framework, the requirement of once every 10 years for landlords really is at significant variance with the accepted guidelines, which is 2 years. Maine is a high risk. Most of the counties are in red. If you saw some of the reports that DHS has up on its website, So we have a higher risk than most states in terms of exposure. Nationally, they've attributed to radon 21,000 deaths nationally. It is the second leading cause of lung cancer. And the mitigation and the testing are not overly burdensome, but they're obviously going to be less burdensome if we do it in a voluntary sense with incentives. So
Okay.
I offer you this to help make the conversation go forward.
So are there any responses or questions to this offered amendment? I'm not seeing anybody with their hand up. Does the people feel like they had enough time to see that in from the email or from the screen share? So it's a voluntary program, Senator Baldacci. It requires something at the time of sale.
No, it doesn't require anything.
Okay.
It's a voluntary program for all classes of participants.
Okay.
And we provide some incentives. So yeah, I took out any mandatory thing because I was more interested in trying to have something constructive.
This is the carrot.
Yeah.
Okay.
I offer only carrots.
Okay. Representative Connor, you're our real estate resource. So designated.
I don't know whether to take that as a compliment or not.
No, it should. You should. You're a valuable resource for the work of the committee, trying to get things right in the realms of real estate. Incentive program, voluntary. How does that sound?
I'm all for an incentive program versus a mandatory program, especially, I rely on Mr. Cashman. And if he is withdrawn his objection to it, I'm more inclined to accept something that is like the senator said, it's incentivizing. So if we can get it out there and incentivize it, as long as it's not mandatory, I'm fine with that.
And if there's adequate dollars to support the effort.
And that's the other big piece, if there's adequate dollars to support it.
Yep. Thank you for that from your perspective. I just buy and sell homes, but for my use, I'm not in the real estate market, don't know my way around. So are any other comments related to this amendment? Since I extracted one from Representative Connor. Representative Perry?
Well, actually, I like what I'm seeing, and I would like to make a motion not to pass as amended.
Second.
So that's been moved and seconded, the amendment being the fiscal note and the fact that the language of the original bill has been replaced. And even though the title still refers to requiring, we understand we can't change titles in our process.
Yeah, I was going to ask that question, actually. I'm glad you raised it. We can't change titles, or can we?
No, you can change the title as part of the amendment. We would have to because you're no longer requiring anything.
Right.
But when you see it on the floor, it's going to have the original title until it actually gets adopted and passed.
Okay.
So you'll see it go forward with the old title, but
Yeah.
the amendment will include the change of title.
Okay, I'm glad you explained that, so I can explain that to other people who may ask the same question. So yeah,
we'll have some explaining to do in our caucuses.
It'll be a lot easier for everybody. Yes.
So if we want to change the title to just creating a voluntary program or whatever the committee wants to call it, that's fine with me.
All right. So the motion on the floor is to approve ought to pass as amended for LD 819. Is there additional discussion and conversation? Representative Perry, is your hand up again or still? There we go. Okay. So not seeing any further conversation, then I would defer to Darlene to collect the vote.
Okay, Representative Zega.
Yes.
Representative Lemlin.
Yes.
Representative Stova.
Yes.
Senator Baldacci.
Yes.
Representative Perry.
Yes.
Representative Griffin,
Yes.
Representative Khanna,
Yes.
Representative Craven,
Yes.
Representative Madigan is absent, Representative Javner is absent, Senator Moore.
Yes.
Yes.
You only get one vote, Senator Moore.
Representative Maya
Yes.
and Senator Claxton.
Yes.
11 in favor of the motion, 0 in opposition, 2 absent.
Thank you.
Thank you very much. I just wanted to say thank you to everybody in your consideration, your time. I know we have a lot of bills, but I appreciate your time.
Thanks for the extra work that it took us to get here. The next bill is to consider is 1437. And okay, that was better to have that gone. Are we good then, Aaron, whenever you're ready? 1437.
This is the bill's second work session.
Oh, that's right. I'm sorry. Thank you for reminding me of this. Get to revisit it. So there has been an amendment that was sent out from Representative Kessler. Have folks had a chance to look at that? Came yesterday at 1:30. Instead of requiring testing, the bill be amended to require information to be given to the buyer about radon in air, as well as well water contaminants, consistent with federal disclosures, and he's included some examples. And then there's some language about how information is to be tracked and transmitted, so that for every sale of a residential property, there's a statement signed by the purchaser that the information has been received, that the information has been read and understood, and that there's a 10-day option unless agreed upon by both parties before becoming obligated under the contract to purchase the house. And he wants to strike any reference to efficiency made. So that's a high-level summary. Any response to that? Yes, Representative Stover.
I would just ask, is 10 days enough?
Well, in the current market, it's too many. I'm thinking. And it depends upon the information that's given and how you feel about mitigating.
Is it realistic? I guess if 10's realistic, that's great. Just want to make sure we're giving a realistic time frame. That's all.
Well, on a home inspection, I mean, if you had a home inspection done, they should flag for you that certain things need to be done, but they wouldn't necessarily have done it the way I understand the way things work. So that can take a while to set up. And in the current housing market, most sales are happening without inspection. So that would have to be mutually agreed upon. So, you know, if you want to buy this house, then you're accepting the radon that's there and whatever's in the well. The radon, if there is any, and whatever's in the well. That's the way this is written. But
that's fine.
Representative Connor?
Thank you, Mr. Chair. Yeah, that's how I was trying to figure out as I was reading this email from Representative Kessler. Was it sounds like they want to switch the liability back to the seller. Is that what they're trying to, is that what this is trying to do, is say the seller must now do a test and provide that test result to any prospective buyer in order to, I mean, that's what they're going to have to do to let them know what the current levels in the home are. Whereas the current practice is, if a buyer wants to know what the current level is, the buyer has to pay for that test to be done. Is this bill switching that roles now?
Not the way I read it. So you have the Dear HHS committee in regard to LD 1437. You have that letter up? Is
Yes,
that-
yes, sir.
Yeah. Okay. So it said, instead of requiring testing, the bill will be amended to require information be given to the buyer for radon in air as information for well water contaminants, as well as information. I took that to mean, and we can interpret any way we want, I took that to mean information exchange, not necessarily requiring testing, because on the lines above, he says, rather than requiring testing. So I took that as a handout from the feds or the DEP or the state, somebody, to say, you may not have thought about this, but radon is an issue in Maine. And so that's the way I read that bill.
Okay.
That proposal.
If I could just take a minute, I'm looking through our real estate documents. I thought there was already a document out that was provided,
Okay.
but I just want to verify.
Okay. Any other points while Representative Connor is doing some research for us? Yes, Aaron.
Looking at the suggested language about the 10-day opportunity before becoming obligated under the contract to purchase the housing or conduct a risk assessment or inspection for the presence of radon in air and water. He does say that unless the parties mutually agreed upon a different period of time, does that mean that this 10-day period would be waived altogether? Could be waived altogether if someone chose not to have a home inspection? Or does that mean they could agree to 7 days instead of 10, for example?
It isn't specific as to intent, and I don't see Representative Kessler with us. It could be from 0 to 365, I suppose. Yeah.
Well, I don't know if it could be 0, as I don't know what the intent is, but as it doesn't look like it can be 0 as presented at the moment.
So then you would include, if you want it to be 0, unless waived by mutual agreement or something. Yeah. Okay. So, so we want to leave the option, or less, yeah, we want to leave the option for waiving it, but we also want to leave open the option if the homeowner needs more than 10 days. That's the problem. Purchase house, you could conduct a risk assessment or inspection for the presence of the hazard. Okay. There's also missing a, no, there's the other parenthesis. And that's too vague, unless they agree upon another length of time. What we say 10 days are mutually agreed upon or waived. Representative Meyer?
Thank you, Mr. Chair. Does this amendment replace the bill?
Yes. The way I've understood it.
Okay.
Representative Connor?
I was going to ask the exact same thing, but I was also just going to let you know that there isn't a specific document that's handed out. It's more of a generalized list, and it just talks about radon. So I believe the intent of this amendment is to give actual radon information. So it is not currently passed out.
Okay, thank you for clarifying that. Is there something attached to that question, Representative Meyer, that you're asking?
Just curious.
Just want to be clear.
Just want to be clear.
Okay.
Yeah, I can't tell that either. For example, like the state employee communication about education, that would go away if this amendment replaces the bill. And I thought that my recollection was that he was clear that that was a piece he wanted to keep. So if this is replacing the bill, then that goes too.
And we're only dealing with the information we have, which makes it a little challenging. And it's been tabled twice already, yeah. I'm not seeing anybody who can answer what the intent of the. Yes, Representative Zager.
Thanks, Chair. Has anybody been able to reach out to Representative Kessler?
I heard from him very early this morning that he was not feeling well. I didn't know if he would make it to a 2:45 work session. Clearly, he's still not feeling well.
So, yeah, Senator Moore.
And I guess that's the question, is trying to understand if his amendment is replacing the bill in its entirety or just making the changes. Because I'm reading over it and he said regarding the testing requirement of the real estate sale portion of the bill. So it doesn't sound like he's replacing the entire bill. Darn, I wish. Yeah.
No, that's a good read of that. I appreciate that. Instead of requiring testing, the bill be amended. Okay. So that makes it sound like the rest of it would stand.
He did say though he was striking that line in portions 10 through 13 dealing with the trust.
Yes.
But just that line though in each of it. So it still would have the K, M, and C and the other part in number 5. At least that's how I read it.
Welcome to end of session challenges with multiple people trying to do multiple places with complicated bills at the end of session. Representative Zager.
Thank you, Mr. Chair. Perhaps we could as a committee choose to either vote on this as we understand it now, or try to deal with the next bill and try to reach the sponsor for LD 1437 to deal with after 1550. Because it seems like there probably wouldn't be appetite for tabling this again, having another third work session on it. But if we want to consider this today without really knowing what the sponsor wants, then it doesn't seem like it's the process intended.
Yeah, Representative Meyer.
Thank you, Mr. Chair. Given what Representative Zager just added to the conversation, and given the fact that there are too many questions, and there may have been many questions from this committee even prior to the amendment, I would move that LD, I'm looking for a number here, 1437 ought not to pass.
I'll second it.
Is there additional discussion of the motion on the floor ought not to pass? Not seeing any, we'll ask Darlene to collect the votes.
Representative Zaga?
Yes.
Representative Lemlin?
Yes.
Representative Stova?
Yes.
Senator Baldacci?
Yes.
Representative Perry?
Yes.
Representative Griffin?
Yes.
Representative Connor,
Yes.
Representative Craven,
Yes.
Representative Madigan is absent, Representative Drapner absent, Senator Moore,
Yes.
Representative Meyer,
Yes.
and Senator Claxton.
Yes.
11 in favor of the motion, 0 in opposition, and 2 absent.
Okay, Representative Connor.
Thank you, Mr. Chair. I just wanted to say that I do think that this has merit, and I like the piece about handing out the information at the transaction. I was a realtor in Alaska, and we had this very same thing. So it was odd when I came to Maine and we did not hand this out. We handed out the radon information as well as the lead paint and lead in the water information. So I think it has merit, and I think it's something that we should definitely look for in the future. Just wanted to put that out there on record.
Thank you. Representative Meyer.
Thank you, Mr. Chair. I want to echo Representative Connor. I know that Representative Kessler is very knowledgeable on these matters and passionate, and has done an awful lot of work around this bill. I think that there's an awful lot here to pull together into something else to bring before this committee, and I would fully support and encourage him to do so.
Okay, so that will conclude the work on LD 1437. That brings us to LD 1550.
Okay, LD 1550 is an act to end the sale of flavored tobacco products. It prohibits the sale and distribution of those products, including flavored cigars and smoking devices. And it specifically accomplishes that with a number of different pieces. One of them is that it amends the definition of electronic smoking device. It adds a definition of flavored tobacco product. It repeals the current prohibition on certain flavored cigars, but then replaces it with a prohibition on a tobacco retailer from selling, distributing, or offering to sell or distribute any flavored tobacco product. It provides that any kind of public statement or claim by the retailer or manufacturer that a tobacco product has or produces a taste or smell other than tobacco constitutes presumptive evidence that it's a flavored tobacco product. It establishes fines for tobacco retailers in violation of this prohibition from selling, distributing, or offering to sell or distribute any flavored tobacco product. Initial fine of $1,000 per violation, and a fine of $5,000 for subsequent violations. A minor, very minor drafting question I had was whether flavored tobacco products needed to include 2 of the flavors included in the current definition of flavored cigars, which is our berries and nuts. The current definition of flavored tobacco products proposed in this bill is framed as including but not limited to, and then it lists a number of different flavors, so it's probably not necessary. I just am noting it because it was just an inconsistency that I noted, but likely doesn't matter very much. You also requested information by the from a number of people who testified. One of the questions was what tobacco products are affected by this bill, and the answer is all of them. So I've included here the definition of tobacco product. And so any of those tobacco products that are flavored and meet the definition of a flavored tobacco product would be prohibited under this bill. Our Kristen, who was with you, our OPLA researcher, Kristen, who was with you at the public hearing, reached out to a number of folks and compiled information related to a number of your information requests. And you also received information from Dan Riley and I think a couple of other folks that we compiled into a single email and sent to you last night. So that included various studies and information. I'm not really in a position to go over that information, but you did receive it. There were also some suggested amendments and testimony. I'm sure folks who have proposed those are prepared to speak about them if you're inclined to go in that direction. So, and that's no fiscal impact hasn't been determined yet. Oh, and it came to my attention that when we were in work sessions today, the governor's press release included something about flavored tobacco products and in its relation to taxes. And Molly is prepared to provide more information on that piece for you.
Let's start with committee members and see if there's any questions based on what Aaron has presented. Any concerns, response, questions? Yes, Representative Connor.
Thank you, Mr. Chair. Aaron, does this prohibit online sales of tobacco into the state? Or is this just Maine retailers cannot sell these flavored tobaccos?
I'd have to go back and look at the definition of tobacco retailer and see how it's defined. The bill itself as drafted doesn't talk about online sales. I'd have to go back and look and see if there's other legislation about that. But perhaps looks like a couple of people have their hands up who could answer.
Representative Meyer.
Thank you, Mr. Chair. Online sales are already prohibited in Maine.
For all tobacco products. Okay. Yes, follow up.
Yeah, I'm curious as that I don't purchase myself. I just know of others, and they have purchased cigars ad nauseum online and had them shipped to their home here in Maine. So I was just curious how that played out if they're illegal to be shipped here.
I'm sorry, except premium cigars.
Is that ad nauseum from being around them, or is it?
A little bit of both.
Aaron.
As a tobacco retailer is defined as a person located within or outside the state who sells tobacco products to a person in the state for personal consumption. So it would apply to any sales to folks in Maine.
Okay.
By a tobacco retailer.
Address, yeah, Representative Connor?
Well, it does, and I was just curious to know what the enforcement mechanism would be. I'm looking at a website here that sells flavored premium cigars. Would they be precluded from selling in the state of Maine? And then if so, how would we enforce that?
The bill would prohibit that. As to enforcement, you'd have to hear from some other folks, I think.
Yeah, that would depend upon law enforcement and post office and ATF, investigating those kinds of things, I would presume. Okay. Any other questions? Yes, Representative Meyer.
Thank you, Mr. Chair. The AG enforces that, Representative Connor. And Maine law requires face-to-face sales.
Okay. Ms. Bogart, you had some other information for us, did you?
Sure, just a note for the committee that the governor's budget proposal includes a ban of basically this bill, a ban of flavored tobacco sales and essentially a backfill of that revenue with general fund.
Okay. All right. Any other thoughts, comments, questions? I'm not seeing any. Does that mean we're ready to? Yes, Representative Craven.
I would like to make a motion. And that motion is ought to pass. Do I have to say amended because of the backfilling of the revenue as amended? Ought to pass as amended.
I second that.
There's a motion and a second. Is there further discussion of this? Senator Moore.
Thank you, Senator Claxton. I've lost a lot of sleep probably over this bill and trying to decide how to handle it and what to go forward with it. When we worked a similar bill last session, our goal was to get the tobacco products out of the hands of our kids. We all agreed. I mean, it's not good. It's not healthy. We want them to grow up to be healthy adults. So we raised the age to 21. And we actually had them put the cigarettes and all the products behind the counter in our convenience stores. And it hasn't worked. It hasn't worked at all. And now we're seeing more and more of our kids vaping. And I've had numerous superintendents that have come to me with concern about our kids in our high schools that are vaping. The numbers are up, and it's affecting their schoolwork. It's affecting their ability to be in the athletic field. You know, they had one that was a star basketball player, and he didn't even go out for basketball because he's afraid he can't breathe. He can't catch his breath because he's been vaping. So I guess what I bring up is the fact that I think our issue, more than trying to take away the flavored tobacco products from everyone and from the adults, that I think we should concentrate more on the vaping products themselves and actually look at that and look at what it would take because it's the flavored products, the flavored vaping cartridges that our kids they're reaching out for it. And they're getting it from somewhere. I mean, they're not 21, but they're getting it. And they're vaping in the bathrooms. They're vaping under their hoodies, so people don't even know that they're doing it. I know that there was one testimony that was given by Dan Riley, and he proposed a committee amendment that actually would end the sale of flavor, that would actually close the loophole that's left by the Food and Drug Administration that was the ban on flavored cartridge vaping products. But this amendment would bar the sale of all flavored vaping liquids, except those that have received tobacco product clearance or modified risk product orders. So it's something that I throw out to the committee. I am concerned. I've always been in support of our small businesses. I know we have a lot of businesses out there that they depend upon those retail sales. I know that when CVS discontinued selling all tobacco products, they saw a very little drop in their retail sales. Walmart, I understand, is considering doing away with all tobacco sales. I know that they no longer sell the vaping products. So I guess I'm just asking the committee that we might think about, what our intent is and what we're trying to do. I know that, one of my husbands loves smoking the Swisher cigars, and that was what he enjoyed doing. So I hate to see us take that away from the adults and their ability to do something that they enjoy, when what we're really, really trying to do is keep our kids off of these, get these vaping products out of the hands of our babes. So I just throw that out as a proposal for maybe for people to take a look at that proposed amendment. Again, it was the testimony of Dan Riley. So I throw that to the committee.
Representative Meyer.
Thank you, Mr. Chair. And thank you, Senator Moore. If we begin to make exceptions, our kids will gravitate to what is available. We know that. We have data that supports that. How many more of our grandparents and parents and spouses need to die from smoking-related illness? How many more of our grandchildren need to pick up a habit that is going to rob them of full and productive lives? How many more? It's time. It's time that we take a good hard look at the impact that we as elected officials, as members of this committee, can have on generations to come. This is about our kids and grandkids. It is a bill inspired by two little boys who are my grandsons, 4 and 6. I do not want to see these children robbed. I don't want to see them addicted. And it's not just my kids. It's yours. I respect the good senator from Washington County but I believe that it is time.
Representative Griffin?
We would like to have a corner caucus if that's okay.
Sure. Can we hear from Representative Lemlin before we do that? So we have everybody had a chance to speak before. Representative Lemlin?
Thank you, Senator. I appreciate it. I oppose all smoking, whether flavored or not. I would love to find a way to get rid of it all. However, once again, I'm willing to bet the farm that because of all the evidence I have read, not just from Massachusetts, but all throughout the country, that whether we ban these flavored products or not, the children are still going to get the product if they want it. Everybody's going to have the product if they really want it. And that's what disappoints me. I don't believe this bill is going to get where Representative Meyer and myself want to get to. I'm in full agreement with her. If I can stop the kids, I would do anything. I would give up my time to help. But I know this isn't going to work. And that's where my problem is. My second problem is we make things like marijuana legal. I mean, nobody has said anything about stopping kids from having marijuana and quite a few other things. Look at alcohol. Alcohol is illegal to children, and a vast number of children in high school, especially, drink. It doesn't stop them. So that's my concern. I'm not sure that this bill is going to achieve the goal that we're all looking for. Thank you.
Thank you. With that, if there's no other pressing comment, we'll take a break for caucus. Representative Griffin, how long do you think we should live?
5 minutes, not going to take too long.
Let's make it 3:20 because that's a round number and it's 12 minutes. 3:20.
Okay.
Okay. I'll try and be back at 3:20. So Darlene, I'd love to have your feedback about how we run things in our committee sometime, not on Mike necessarily. But you've had
That'll be good.
now that you've had a few years of experience, I'd be interested to hear if you had any suggestions for us.
We can talk.
Okay.
No, actually, I think you do just fine. Yeah, I've been doing, actually, this used to be my committee a long, long time ago.
Are you having flashbacks?
Well, we didn't really talk about radon, but I do remember you guys like the one bill that was really funny was raising the cigarette tax by $1. And one of the members was like, how do you like me now? And I'm like, it doesn't really affect me.
All right. So it looks like we're back and on time. So that's appreciated. I hate getting in trouble with Senator Moore. Where we left the conversation was the motion on the floor was ought to pass as amended, the amendment being a fiscal note. Is there additional discussion input on the part of the committee? Then we'll ask Darlene to collect the vote.
All right, Representative Zaga.
Yes.
Representative Lemlin.
No.
Representative Stova.
Yes.
Senator Baldacci.
Yes.
Representative Perry.
Yes.
Representative Griffin. Nope. Did you? I didn't hear her.
Okay. No.
No. Representative Connor.
No.
Representative Craven.
Yes.
Representative Madigan is absent. Representative Javner absent. Senator Moore.
No.
Representative Meyer
Yes.
and Senator Claxton.
Yes.
7 ought to pass as amended. 1, 2, 3, 4. And I'm assuming the 4 ought not to pass, or?
We'll ask.
No, I would like the minority report to be an ought to pass as amended, with the amendment being, I believe he's listed as Exhibit 6 in the testimony of Dan Riley, where it does actually closes the loophole left by the Food and Drug Administration on their 2020 ban on flavored cartridge vaping products by banning the sale of all flavored vaping liquids, except those that have received tobacco product clearance or modified risk product orders. So I would like that to be the minority report, please.
And everybody's in agreement?
Yes.
Yes. Okay.
Aaron, you have that amendment. Okay. All right.
I do. He sent it to me.
Good. Okay. Oh, that's right. I remember. Yeah. Okay. So next, having completed our work session portion, and before we get to some amendment reviews, we have a new bill to hear, which is LD 1695. And let's see here. Who's here to speak to that?
That is Representative Morales's bill.
I'm reaching out to her now.
Should we take a 5-minute break and see if she shows up? And
Yeah, I think a 5-minute break would be good.
or I can push back from the computer. You want to mute, Darlene?
Yeah, no, I just realized that it was still on.
I lost track of what time 5 minutes from before was. I usually write that down. I got distracted trying to get Darlene to turn off her mic.
Yeah, as you listen to me chomp on a pretzel, and all of a sudden it's like, oh my God, they can hear this.
Sounded good.
Sorry about that.
All right. I tried to bring the sponsor in, and she was here. There she is. I'll try. You know, I can't bring her in. You need to bring her in, Darlene. Can you bring in Representative Morales? I lost my bring him in privileges.
You did? Because I
No.
don't even see her.
At the
There
bottom.
she is. Okay, yeah, I see her. And then I'll give you back your privileges.
Just for the record, I tried several times, Representative Morales, but I was thwarted by the software. Or Darlene.
I didn't touch it. I swear to God. But you are now a co-host, so you can move people around.
Oh, thank you. Thank you for that promotion. All right. So that brings us to consideration of LD 1695. The sponsor is in the House. So we'll turn it over to you, Representative Morales. When you're unmuted and ready to join us, we want to hear about this bill.
All right, thank you so much. Can you hear me okay?
We can.
Okay, I appreciate it, and I'm sorry. Sorry, I've been bouncing a little bit to various committees. Let me pull up my testimony here. Good afternoon, Senator Claxton, Representative Meyer, and esteemed colleagues. My name is Victoria Morales, and I represent South Portland in House District 33, and it is my honor to bring this very important policy to you today. There are two kinds of policies that come before you. One requires new thinking and new initiatives, and one is grounded in improving on existing policies. And I think you all will be very happy to know that this bill is about improving on an existing policy. General assistance is an essential Maine policy that has helped thousands of Maine people escape houselessness and provide other basic emergency needs for many years. For those of us who work with general assistance to help folks avoid or move through housing insecurity and houselessness, we understand how essential this program is. We are here today because we can make this policy better. We can remove barriers to accessing these essential services and create efficiencies in the delivery of these services, particularly in this time of crisis, where too many Maine families, children, workers, and vulnerable adults are housing insecure, food insecure, and income insecure. This bill provides as follows. In Section 2 of the bill, it addresses general assistance maximums. The way the current policy works is that there is a maximum amount allowed for each general assistant applicant, whether they need housing assistance, food assistance, or assistance with other essential needs, or, as often happens for Maine people, all of the above. The result of this policy, however, particularly at a time when housing costs are rising everywhere in Maine, if an applicant can find a landlord willing to rent to them, they are provided the maximum just to pay rent, but then they are ineligible for food assistance and other essential needs because the housing costs met or exceeded the maximum amount allowed. The solution that this bill offers is as follows. If the housing costs meet or exceed the GA maximums, the person would still be eligible to receive food assistance and other essential needs. This solves a very big problem. And I'll just give an example from Biddeford, where we were housing a client recently. The client qualified for general assistance for a 3-person household needing a 2-bedroom. The maximum amount was $1,212 that could be allowed. The maximum rent was $1,140, which is exactly what the rent cost. And then what was left over was only $72. And so that family only was eligible for $72 in food assistance. And of course, they needed much more in a month. Section 3 of the bill requires that municipalities presume that someone who is houseless is eligible for general assistance, even if there is no shelter in the municipality. Currently, under the GA statute, municipalities presume eligibility for general assistance when folks present at a shelter in that municipality. However, the problem is, and you all know it, we have so few shelters in our approximately 500 municipalities in Maine. The solution that this bill offers is to allow municipalities to presume that someone who is without a home is eligible for GA, even if there's no shelter in that municipality. This provision removes the burden that municipalities face in determining eligibility and can get assistance to folks more quickly to address and hopefully avoid these kinds of crises. Section 4 of the bill streamlines the process for shelter reimbursement and requires the state to pay 100% of shelter costs. The reality is that shelters exist because we lack housing in Maine. In fact, and you all know this, we lack 20,000 units of housing in Maine. This fact contributes to the housing crisis in two ways. With a demand for housing that greatly exceeds the supply, it is a landlord's market, and the cost of housing statewide has risen tremendously. Folks are paying 50% or more of their income towards the increased housing cost, making the rest of their lives that much more difficult to afford and making them vulnerable to eviction. And as we all know, approximately 5,500 households in Maine experience eviction. Once folks receive general assistance, they do not have many options because even if they find a landlord who will accept general assistance, the housing costs are higher than the GA maximums. Since we only build between 200 and 250 affordable housing units per year, and historically we only spend 0.00643% of our state budget on housing, Maine must take responsibility for this housing crisis and build more housing and support all of our incredible shelter providers 100% who are picking up the pieces of our failure to invest in housing infrastructure for so many years. Section 5 of this bill requires that the state reimburse municipalities 90% of the rental assistance provided by general assistance across the board, which is an increase from currently reimbursing municipalities at 70%. This policy change solves a very big problem. Today, 80% of general assistance goes directly to housing assistance. It is very difficult for the approximately 490 out of 500 municipalities who are on the smaller side to administer and fund the current 30% share of general assistance from their municipal budgets without more assistance from the state. I think we all agree that homelessness knows no boundaries and does not respect municipal lines. When someone can't stay in their community because their community does not have the budget to help them through a homelessness crisis, they are forced to seek help elsewhere, which places a burden on another municipality and further disconnects that person and family from their home community. Section 5 of this bill will relieve home communities from this burden and help folks stay within their communities when they are experiencing a crisis. Section 6 of this bill requires a person who is receiving rental assistance under the General Assistance Program for more than 30 days to be prioritized for a more stable housing voucher administered by the Maine State Housing Authority. The message we have received from folks on general assistance and landlords in Maine is that they would more readily accept tenants with general assistance, which requires a monthly eligibility, to transition to a more sustainable housing assistance solution, such as is administered by Maine Housing and by Department of Health and Human Services through their BRAP vouchers. This section also transfers unspent state funds for general assistance to the Department of Health and Human Services for rental assistance programs administered by the Office of Behavioral Health and to the Maine State Housing Authority for the Housing Opportunities for Maine program, the Home Fund. This year, the unspent general assistance fund totaled $12 million. With $12 million, we could house 1,600 households for 1 year. That is significant, given the 25,000 household wait list for Section 8 vouchers currently in Maine. This bill also provides for important housing navigation services to go along with general assistance. So I'll stop there. It's a very important bill, and I will take any questions that the committee may have.
Thank you, Representative Morales. Are there any questions from the committee members? Yes, Representative Zager.
Thank you, Mr. Chair. Representative Morales, I really appreciate you bringing this bill forward. I was wondering what happens currently with this $12 million. That seems like a lot of money.
What happens currently is that it can go back into the general fund. And that is what we voted to do for, I think, about $3 million of that recently in our budget process.
Thank you.
Yes.
Are there any other questions? I don't see any. So we'll go to hear from Cullen Ryan. Welcome.
Thank you very much, Mayor Claxton. And I just have to pop my testimony up here. There. And Representative Meyer, members of the committee, thank you very much. My name is Cullen Ryan. I'm with Community Housing in Maine. I think you're familiar with my background by now, and I'm supportive of this bill. I work with populations that experience homelessness and use general assistance, and this is a key safety net resources for the populations that experience circumstantial homelessness in particular. For this bill, we know that rents throughout the state continue to climb and more people are using the GA maximums. This idea that you would have basic necessities along with housing makes sense to me. And so having that included makes sense as well. So I support that provision of the bill in particular. Extending presumed eligibility for people experiencing homelessness makes sense to me as well. We're using resources to cover the cost of motels right now, and where shelters are at capacity and they're turning people away. This practice has worked extremely well through the pandemic, and keeping this going would make sense to me as well. It would find a large gap in the continuum of care. And we'll note that the way that general assistance is administered statewide varies greatly, and this really has to do with this affects how we're dealing with homelessness. So please ensure that upon adoption, if you adopt this, that the general assistance is administered uniformly across municipalities so that someone experiencing homelessness in any part of the state is treated the same. That's the crux of Maine's homeless coordinated entry system, which is just about to get up and going, and it's in line with best practices. The reimbursement to municipalities, this is key. States would reimburse towns 100% of the costs, and this would allow Maine towns to better address homelessness by enhancing the state reimbursement rate. It's a crucial step to making general assistance a more effective tool in addressing homelessness. Shelters haven't had the resources to maintain sufficient capacity for years, and the pandemic has exponentially worsened this crisis. Increasing the GA maximums would ensure that municipalities provide emergency shelter for people and won't rely on other towns to do that as they often do now. And I'm sure you've heard of towns saying that they're getting all sorts of folks coming to them because other towns don't do this. This would level the playing field. General assistance is Maine's safety net of last resort. It protects thousands of Mainers by keeping a roof over their heads when they have nowhere to turn. Let's work to ensure that people experiencing the emergency of homelessness truly have access to general assistance. We will be better for having people sheltered versus on the streets or stuck in places unfit for human habitation.
30 seconds, sir.
By enhancing general assistance, this bill would work to do exactly that. And finally, I didn't include here, but the idea of having leftover resources go to create housing intrigues me, and I'd love to learn more and support that as well if that can happen. Thanks for the opportunity to testify, and I'm happy to answer any questions.
Thank you, sir. Are there any questions of Mr. Ryan? I'm not seeing any. So we'll thank you for being here.
Thank you very much.
We'll welcome Deborah Bonwa.
Hello.
Hello.
Thank you for having me. Good afternoon, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Debbie Bonwa, and I'm a policy and legal advocate at Maine Equal Justice, a civil legal services organization that works with and for people with low income seeking solutions to poverty through policy, education, and legal representation. Thank you so much for the opportunity today to testify in support of LD 1695. We have a long-term housing crisis right now that is also a racial equity crisis and a public health crisis. Maine Equal Justice supports this bill as a first step towards addressing this, especially during this pandemic, by making this essential program more stable and more reliable. General Assistance, or GA, is an essential program that provides critically needed housing assistance to Maine's most vulnerable residents and to those with no other resources. It is also the only program without a waiting list, so it's mostly immediately available to most people. GA is a municipally run program that provides financial assistance in the form of vouchers to those that are eligible so they can afford their basic necessities. It's a last resort, as you've heard, and many times it's the only resort for many people to be able to afford basic needs and rental assistance and other basic necessities. Currently, there's 80% of GA expenditures going towards rental assistance. The number of families behind on rent and who face eviction is at least 20,000 right now. And 26% of Maine's homeless population is Black or African American, even though they only make up only 1% about of Maine's population. I won't go through everything that the bill does because you've heard that very clearly from the sponsor before me. But the changes proposed by this bill are definitely necessary so that low-income Mainers can avoid homelessness. In addition, GA is the only source, again, of rental assistance or any safety net that people have right now because they're not eligible for anything else. And those families cannot be left behind. If any of us are left behind without safety nets, then we only worsen the public health crisis and put ourselves in more danger. For these reasons, and those stated by Representative Morales before me, Maine Equal Justice strongly urges the committee to pass LD 1695. And I'm happy to answer any questions.
Thank you for your testimony. I'm not seeing any questions from the committee members. So we can move to Izzy Ostrowski. Welcome.
Thank you. Good afternoon, Senator. Oh, am I echoing for other people? I am. Okay. Let's try it again. Good afternoon, Senator Claxton, Representative Meyer, and esteemed members of the Committee on Health and Human Services. My name is Izzy Ostrowski, and I'm the Social Change Advocate at Preble Street, a human services anti-poverty agency with over a dozen programs and services provided across the state. I am here today to testify in support of LD 1695. Throughout our programs, case managers work with individuals and families experiencing homelessness and connect them with safe and supported resources. General assistance, GA, can be a life-saving resource for the most vulnerable members of our community. The COVID-19 pandemic has exacerbated food and housing insecurity and has subsequently left many people unable to pay rent, mortgages, and food costs. Individuals and families have accessed GA to be connected to basic needs such as safe shelter, food, medication, diapers, and housing expenses. When individuals and families cannot meet their basic needs, they are not able to focus on housing, employment, or educational opportunities, further trapping them in homelessness. During the pandemic, GA has provided emergency shelter through motels to individuals and families experiencing homelessness. Every day, Preble Street volunteers deliver hundreds of prepared meals to people staying in motels in the greater Portland area. During a visit to one of the motels, I spoke to a woman who told me that she and her 2 young children had been staying in one of the motels with assistance from GA. For this mom and her 2 children, staying in this motel kept them from unsheltered homelessness and connected them with other resources. GA resources are deeply connected to the homelessness response system in Maine and have played a large role in addressing the crisis needs of people experiencing homelessness. Though GA can help in connecting people with permanent housing by offering them safe and stable shelter as well as providing basic needs, LD 1695 would further help individuals accessing GA to obtain permanent housing. Ensuring that households who have been accessing GA for a month or more be prioritized for housing vouchers would help to move people out of homelessness and into housing, rather than languishing in homelessness. Maine is experiencing a housing crisis, and as we sit here today, more individuals and families will be evicted from their homes and plunged into the life-threatening risks of homelessness. Like the mom I mentioned earlier, there are families, veterans, elderly people, and individuals utilizing GA, and it is saving them from homelessness. We at Preble Street, thank you, have never seen such a dire situation as we have this past year. This critical piece of legislation has the opportunity to help GA move beyond just meeting basic needs and toward being a meaningful part of ending homelessness in Maine. And for that reason, Preble Street asks you to vote in support. Thank you.
Thank you. Any questions from the committee? I'm not seeing any. So now we will hear from the Honorable Eric Jorgensen.
Good afternoon, Senator Claxton, Representative Meyer, and esteemed members of the Committee on Health and Human Services. My name is Eric Jorgensen. I'm Director of Government Relations at the Maine State Housing Authority. I'm testifying in opposition to the housing provisions in LD 1695. I think it's really important to understand that we recognize that general assistance is in many ways a very important housing program, and that there's likely a great deal of value to improving how it can be accessed. But that said, we find that the housing parts of this bill don't appear to be workable to us, and that's what I'm going to address here. So it's a kind of narrow opposition to this. Our chief concern with this bill relates to Section 4311A, which prioritizes homeless individuals for federal or state housing vouchers. There have never been state housing vouchers, although there's a bill being considered to create them this session. And for Maine Housing, at least, our agency's federal vouchers are already prioritized at this population. So for us, this part of the bill is unnecessary, at least as a conceptual matter. That said, we have practical concerns about prioritizing such a large potential group of new voucher seekers. A bigger issue is that Section 8 vouchers are provided not just through Maine State Housing Authority, but through 23 other local housing authorities across Maine, which are independent and which work directly with HUD. We serve as the housing authority only for localities that are not covered by other authorities. And so to specify only Maine housing in this bill will rule out the inhabitants of most of Maine's larger communities. Perhaps a more general issue here is about bills that direct us to prioritize certain groups for vouchers. This session, there's at least one other bill that asks us to similarly prioritize a different group in receiving housing choice vouchers. So how can we move one group to the head of the line over another group that's also been prioritized as the result of another bill from the 130th legislature? There's only one place at the front of the line. There are very few people in the Section 8 queue for whom a compelling argument for prioritization can't be made. Each housing authority has its own priority groups. And just as Maine Housing sets aside 60% of its vouchers for people experiencing homelessness, a local public housing authority might give preference to people from their own community or, per current law, to a local veteran. And so it's important not to forget that HUD requires, this is also important not to forget that HUD requires that programs draw down from their waiting lists. So I guess the question I ask is, what about all those families on the brink who have been on the waiting list for 4 or 5 years? It's less a question of whose case is the most urgent than one of who gets skipped over. And that creates fundamental questions of fairness, in our mind at least. If the legislature wants to address housing choice voucher preferences, then we hope you would do so in a holistic, comprehensive fashion that considers all the people in line in all the regions of the state. We also have concerns about the term notwithstanding any provision of law to the contrary, as we are not sure what other parts of the law might be inadvertently nullified with broad language like that. The statewide veterans preference mentioned above is just one example of what might be canceled out with a notwithstanding provision. Then there's a few small things I'll just mention. We completely agree there's a catalytic good that comes when someone moves from homelessness into stable housing. It's a very, very, very good thing. But we would argue that the housing provisions in this bill are too prescriptive. Our ideal solution would be for the committee to remove all reference to housing choice vouchers from LD 1695 and move it along as a general assistance reform bill. But if that's not the committee's preference, then we would greatly prefer that this one section of the bill be amended with more permissive language. If in line 37 must could become may, this problem would be lessened. In addition, we would note that Maine Housing and DHHS already have rulemaking authority, and so we would ask that shall adopt rules be changed to may adopt rules, depending on what is needed. And then we also wanted to alert you to a potential drafting problem that comes from putting provisions governing Maine State Housing Authority in Title 22 instead of Section 30A or Title 30A where we normally are. So those are our concerns. Our only objections are really with the housing parts of this bill. I think it's got a lot of merit other than that, and we'd be very happy to try to answer any of your questions.
Thank you, sir. Are there any questions for Representative Jorgensen? I don't see any. So thank you for that perspective. Will you be at the work session or somebody? from
Absolutely.
the- Okay.
Yep, happy to be there. Do we
Okay.
have a date for it yet? Sorry.
What are you doing tomorrow? Do we
It's-
have it
It's next Tuesday.
next
Okay,
Tuesday?
thank you.
All right, thank you. All right, I don't see any other questions. So that'll conclude the public hearing portion, consideration of LD 1695. This is our chance to ask Anna for any additional information that you need. Representative Perry.
Yeah, I have a question. I thought we had passed a bill to increase reimbursement for GA to 90% and 100% for Wabanaki public health or such. Is that the case?
You sent a bill to the table. It hasn't actually, well, you haven't sent it to the table yet. You've reported out a bill where the majority on this committee voted for that. I assume it will be on the calendar when you meet next week.
Okay, thank you.
That's why that sounds familiar. Yep. Any requests of Anna for the work session? I don't see any. So that'll end the consideration of LD 1695. And rumor has it that there are a half dozen amendment reviews to accomplish.
Yes, I don't think they're not particularly complicated. I don't think they'll take very long, but I'm just going to put them in front of you quickly and we'll move through them. Okay, this is LD 81. This was a unanimous committee report. This was about the period of time children would be in authorized to stay in emergency and other homeless shelters. And you changed it from 60 days to 90 days. And you also, section 3 here is the piece about tracking the rules between around notification and consent make them consistent with chapter 8. So the other bill that you considered at the same time of this, LD 1076, you'll see, you haven't seen that yet, that's coming, but that was just the appropriation piece of it. This bill was just the language piece of it.
Everybody okay with that?
Can you see 497? Okay.
Yes.
Okay. This Representative Madigan's bill, it's a directive to the Department of Health and Human Services to report back to this committee on its work done relating to child abuse prevention services under Family First Prevention Services Act. And it outlines the work the department is anticipated to be doing as part of the state agency partnership for prevention and to fill the committee in on that next year with an authorization to report back. And that is a unanimous committee report.
Well, soon everybody will speak up if there's any concerns.
An LD 81's fiscal note looks similar. It was a minor cost increase, but no dollars attached. Similarly, 497 indicates a potential minor cost increase that can be absorbed within existing resources. 792 is about the HOPE program. This was language that you've largely seen before that was presented at the work session. I think there were just a few minor tweaks, but I can't identify where they were right now, but I did not believe that they changed it substantively. And then there's no fiscal impact to the changes under the HOPE program. You've seen this language on LD 606 at the work session. This is what you voted on. There were a couple of tweaks from thes and us to the reverse, but nothing substantive. This is about the department communicating or receiving information from providers during the period of time that a family might be involved in a child protection case. And it indicates, the fiscal note indicates that there's a minor cost increase that can be absorbed within existing resources. LD 78 is the TANF benefit that would remove the full family sanction. The amendment on that was unanimous to add this report back here in section 3 on how the implementation of that policy change is going. And you saw this appropriation at the work session. It's entirely federal block grant funds. And that's what's shown on the full fiscal note as well. And then finally, there's just one more. LD 475 is the Fuse collaborative, and it shows that you've updated the membership to add municipal officers, psychiatric officers, psychiatric hospital, and providers of community-based behavioral health services, I think were the new ones. Maybe also providers of emergency health services and the Sheriff's Association. It indicates that members must represent a wide geographic area of the state, and it changes it to authorize you to report out a legislation, not just a bill. So it gives you increased flexibility there. And the fiscal note shows minor cost increase that can be absorbed.
Well, thank you. Any questions, comments? So tomorrow's another day, starting at 10 with hearing from the Department of Corrections about MAT. And then a series of work sessions to take us into a Friday off. All right, Representative Zager.
Thank you, Mr. Chair. Very quick point for the record. Earlier today, during one of our many discussions, I mistakenly referred to MMA as the Maine Municipal Association. Actually, it was the Maine Medical Association in a piece of testimony I was looking at. So I just wanted to correct that for the record. Thanks very much.
I only did that 3 or 4 times last session. All right. Any other questions, comments? Then I would entertain a motion to adjourn until tomorrow at 10.
So moved.
All those in favor? Have a good evening.